Welcome, everybody.
Yes. Okay.
So I think we're live stream now. So welcome everyone to this morning's Health and Human Services Committee hearing. We'll be listening to two bills today, and we'll listen to them in the order in which they're published, which is 1523 and 1693. I'll have some specific suggestions about how to approach the testimonies on both bills before we get to them. But for now, I want to remind everybody that we have our own YouTube channel, and you can watch the committee proceedings from there. It's all recorded, so if you miss anything today, you can come back. We always flag unplanned technical adventures that we have in the committee, so just so people are aware of those. We anticipate that they will happen, and we're not sure when or who or from where, but a couple of thoughts. If your audio begins to break up, if you shut down your video, often we can hear you better. So I pass that along for people who are here to testify. The committee is aware of the request to stay on mic and to turn off phones, Representative Perry, and be good about those kinds of things. So everybody who wants to testify will be heard. We ask that you address the bill to which you're speaking or the concept. And please identify yourself correctly on Zoom by clicking on the dots in the upper right-hand corner and renaming yourself so we know who we're talking to. When you get changed from attendee to participant, you go into what's come to be referred to as a black hole. Don't give up. You're coming through the other side, and we'll eventually hear your testimony. If you have additional testimony to provide or haven't given us anything written, you can do that up until the time of the public hearing. That's always welcome and will be reviewed by committee members. The chat is not available for those waiting to testify. We use it in the committee only for moving things along and addressing technical procedural issues. So there's a 3-minute limit. And we've asked, Senator Moore has actually volunteered to do the 3-minute clock, and we'll be taking breaks at 1 hour and a quarter, hour and a half, and Representative Griffin has offered to flag those for us. So with that in mind, I'll have the committee go to introduce itself and begin with Representative Zager.
Thank you, Senator. Good morning, everyone. I'm Sam Zager. I'm honored to represent District 41 in Portland.
Representative Lemelin.
Thank you, Senator. Good morning, everyone. My name is Michael Lemelin. I represent House District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Booth Bay Harbor, Southport, Edgecombe, Westport Island, and part of South Bristol.
Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Cadesco.
Yeah, possible too.
Representative Connor.
Thank you, Mr. Chair. It is great to see everyone. My name is John Connor, and I represent part of Lewiston. So awesome to be back, guys.
Great to see you. That takes us to Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Thank you. Representative Meyer.
Thank you, Mr. Chair. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton, honored to serve the folks in Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. I will note that several committee members are not with us because they're either in other committees or and testifying or participating in some other event they couldn't get out of. So not to be alarmed by that. We're joined by our crack staff who keeps us on task and focused. And so I'll turn to you, Sam.
Samuel Seneft. I'm an analyst with the Nonpartisan Office of Policy and Legal Analysis.
And to you, Karen.
I'm Karen Thomas, the clerk for the HHS committee. If you should need anything, please email me at hhs@legislature.maine.gov. Thank you, Senator.
Thank you for that. So as we get to testimony and we begin to invite into the room, if you would, Karen, folks who will be providing testimony. I'm looking for Representative Millette. I don't know if Senator Jackson's here. And Senator Carney and Senator Vitale, if they're around, they should be being brought in as we go along. And then we'll go to a list of non-legislative folks who'd like to testify. All right, so the first bill addresses the Trust for Healthy Maine. And I ask anybody who is planning to testify related to such a trust, speak up for this portion of the hearing and not wait until 1693, which also includes exactly the same language. We'd like to try and get the trust conversation done with in one chunk because it's a complicated, important issue and want to get it right. Okay, so I see that the sponsor is here. So welcome, Representative Millette. The floor is yours.
Good morning, everyone. Good morning, Senator Claxton, Representative Meyer, and esteemed colleagues on the Health and Human Services Committee. I am Representative Rebecca Millette, and I represent House District 30, which includes most of Cape Elizabeth. I am honored this morning to present for your consideration LD 1523, an act to establish the Trust for a Healthy Maine. As a member of the Educational and Cultural Affairs Committee, I always assess public policy first and foremost through the lens of what's best for Maine's children and families. And like most of us, I have watched with sadness and anger as another generation of Maine youth have fallen prey to the tobacco industry as e-cigarette use or vaping has reached epidemic proportions in our schools and communities. The reality is the tobacco industry has been stacking the deck against Maine kids for decades with predatory marketing campaigns, product promotions, and the promise of fitting in, being cool, and feeling a relief from stress and anxiety. Our job as policymakers is to protect Maine kids and put strong guardrails around the tobacco industry. We can do that by 1, getting products that hook kids off the store shelves. 2, fully funding a best practice tobacco prevention and treatment program. And 3, investing our tobacco settlement as it was originally intended, preventing youth tobacco use and giving our young people the chance to grow up free from nicotine addiction with healthy brains and bodies in the communities that give them hope, connection, and opportunity. This bill will assure 2 of those 3, while the bill you'll hear later this morning, LD 1693, will assure the 3rd. I hope you will join me in seeing both the opportunity and the responsibility before us to set things right, fix what's broken, and stand up for the health and well-being of Maine's kids and communities. Maine is at a critical juncture. Tobacco settlement revenues are about to drop again, and this time dramatically, which will make the current fund for a healthy Maine baseline of $55 million per year impossible to sustain in the next biennium. We have an important decision to make. We can do nothing and hope for the best, or we can restructure and modernize this 20-year-old fund for the health of our children and our future. Doing nothing is a lose-lose scenario. Without action, medical care, public health, and prevention programs in the Fund for a Healthy Maine will be pitted against each other for limited resources in the next biennium, at a time when we can all agree when we need to be doing so much more to strengthen and integrate our healthcare and public health systems, especially in our rural regions and in communities experiencing health disparities. Alternatively, acting now will be a win-win. by restructuring the tobacco settlement in this biennium, there is no immediate threat to programs, nothing to bargain away, and no fiscal impact. With a simple transfer of funds and the creation of a long-term public health trust, we can stabilize Maine Care, Head Start, Child Care, and Drugs for the Elderly programs in the general fund, automate the full funding of Maine's tobacco prevention and treatment program, create an ongoing revenue stream to address health disparities and support community-based infrastructure, and allow for longer range planning and investing of settlement dollars in alignment with the highest priorities of our state health plan. Specifically, this bill will create the Trust for a Healthy Maine, which will be funded with annual tobacco settlement payments estimated at roughly $31 million a year starting in fiscal year 24. The governor will appoint and the Maine Senate will confirm all members of the Trust for a Healthy Maine. After the creation of the trust, Racino revenue will continue to flow into the Fund for a Healthy Maine and fund a portion of the Drugs for the Elderly DEL program. The Fund for a Healthy Maine will also remain available for other revenue and allocations as determined by the legislature and administration. I've included a simple bar graph in my testimony, and others following me will speak to the financial details in this bill's proposed restructuring of the tobacco settlement into the Trust for a Healthy Maine. The amendment I am submitting with my testimony today includes the language necessary to resolve the structural deficit in the Fund for a Healthy Maine, which will then allow for the creation of our new public health trust, the Trust for a Healthy Maine. Now it's time to decide, will we take action or will we let this final window of opportunity pass us by? I urge us to act now, not just because it's good policy, but because it's right and a just policy. A public health trust designed for the future and funded from the ethical, moral imperative of not losing one more child to tobacco addiction will be an inspirational, motivational, community building moment for the entire state of Maine, something we can all be proud of, reminding us of our ability to come together to solve big problems and do what's right for our kids and communities in a fiscally responsible way. Much research, informed thought, and collaboration have gone into developing the model outlined in LD 1523. It is based on the successful structure of the Efficiency Maine Trust and heavily informed by our experiences here in Maine and those of other states in protecting the tobacco settlement. A tremendous amount of work has gone into resolving all of this committee's questions and concerns from 2 years ago, when LD 1961 was left unfinished due to the COVID pandemic. I'll end by reminding us that the 119th legislature did an amazing thing more than 20 years ago in their creation for the Fund for a Healthy Maine. It has served us well and longer than most states' efforts to protect this revenue stream. As proud members of the 130th legislature, it's now our responsibility to chart a course for the next 20 years. There could not be a more important moment to be doing so. I'm honored to be working with all of you on an issue of such significance to our children and our state. Thank you, and I'm happy to answer any questions.
Thank you, Representative Millette. Are there any questions for the representative related to this bill? I'm not seeing any. Normally in the course of events, we would go to co-sponsors and then other legislators. I want to thank publicly Representative Sachs for offering to defer her testimony time until later in the day so that somebody with a tight schedule and twins could get in earlier, but it doesn't work out right now. So I'd invite Representative Sachs to go ahead. And as she gets ready to do that, I'd ask Representative Perry to introduce herself. When she can find them.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Calais, Charlotte, Robinson, Perry, Pembroke, and Pleasant Point.
Very good. Representative Sachs, the floor is yours.
Good morning, and thank you for the accommodations to one of my favorite committees. Good morning, Senator Claxton, Representative Meyer, and esteemed members of the Joint Standing Committee on Health and Human Services. My name is Melanie Sachs. I'm honored to represent House District 48, which includes Freeport and part of Pownell. I'm before you today as a co-sponsor and strong supporter of LD 1523. I found in my first term that one of the strengths of the 130th legislature has been the willingness to not only identify difficult problems, but also to attempt to develop long-term sustainable solutions. This has been seen in such areas as affordable housing, criminal justice reform, and equity. This is also true of the bill before you, an act to establish the trust for a healthy Maine. Despite our collective best efforts, we've been unable to maximize the return on investment from the monies Maine receives each year from the Tobacco Master Settlement. The Fund for a Healthy Maine, where those funds are deposited, has been increasingly used to fund medical care instead of prioritizing tobacco prevention and control and other public health programs. I wanted to let this committee know that we recently heard a bill in the Tax Committee by Representative Jay McCrate that seeks to assure that the funding directed to tobacco prevention programs may, quote, not be less than the lesser of the amount of tax collected on tobacco products plus funds available in the Fund for Healthy Maine, or alternatively, quote, the funding level recommended for this state by the U.S. State Department of Health and Human Services Centers for Disease Control and Prevention, pursuant to its determination for state tobacco control programs. This is an attempt to assure a sustained funding stream. That bill, in conjunction with the bill before you today, both seek to protect our state's investment in this and other important programs. LD 1523 will ensure oversight, investment, flexibility with the ability to both respond to immediate needs as well as provide long-term stabilization. It is a recognition that we must find a sustainable solution to funding critical prevention programs. As you've heard many times in this committee, sustained investments in public health and prevention programs net a much greater return by both improving health outcomes and reducing overall health costs for the citizens of Maine. I urge you to unanimously support LD 1523 as a prudent measure from both a fiscal, public health, and planning perspective. Thank you for the opportunity to speak with you about this important bill this morning.
Thank you, Representative Sachs. Are there any questions of the co-sponsor? I don't see any. So in the normal course of events, we'd go to a list, but we have somebody who has an special excuse. So I'd invite Katie Hess to go ahead and join us and testify.
Hi, I really appreciate it. We lost our childcare and we have infant twins and they're napping. So the flexibility is much appreciated.
Twins get you special privileges.
Yeah, much appreciated. So hi, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Kaylee Hess. I'm the Associate Director of the Partnership for Children's Oral Health. The partnership is a network of individuals and organizations working to create a Maine where all children can grow up free from preventable dental disease. We submitted written testimony in support of LD 1693, which you'll hear about, and because oral health equity is central to achieving oral health outcomes for Maine children, and we're lacking in a lot of infrastructure to do that work right now. We've also testified in support of ending the sale of tobacco flavors before, which you can read about in our testimony. But as Senator Claxton said, we're going to speak primarily to the issue of the Trust for a Healthy Maine right now. But I am happy to answer questions about those if you have any at the end of this. So the partnership is invested in ensuring that the state of Maine has sufficient resources and capacity to provide good oral health leadership to address the oral health challenges facing the state. One critical effort right now is the school oral health program, which is currently run by the Maine CDC in about a third of Maine schools, probably fewer now due to COVID. This program provides screenings, fluoride varnish, and sometimes sealants to children who need them. And these are essential services to help protect oral health for children, particularly when so few children are able to access care in a traditional dental office. For the last 8 years or so, a small allocation of funding from the Fund for a Healthy Maine has been the only source of ongoing funding for this program. It's between $200,000 and $300,000 per year typically. These resources are insufficient to address the oral health needs of all Maine children or even bring this evidence-based program to all schools, but this program provides really vital services for the children that it does serve. Dental caries is a very painful disease, and it's one of the most common chronic diseases among Maine children. So losing this limited funding would be devastating for the kids who do need these services. Oral health and access to dental care comes up repeatedly in community and state needs assessments, but then it often falls off the priority list just behind other pressing health needs. And without the solution identified in this bill, the Fund for a Healthy Maine, when it becomes insolvent, it would not be surprising to us to see that oral health falls behind other, behind everything else in the subsequent chaos. We're deeply concerned about the impending cliff and the inevitable decisions that will have to be made about which programs to cut or eliminate. A reduction in the Fund for a Healthy Maine allocation would jeopardize Maine's ability to maintain the limited school oral health program. It could even threaten our ability in Maine to apply for federal oral health funding in the future, as these Fund for a Healthy Maine dollars are the only state funds that currently can be used as matching funds for other federal oral health grant opportunities. We are impressed that this bill has faced this uncomfortable reality and identified a proactive solution rather than simply waiting until we go over the cliff. Public health solutions take time, and prevention efforts need stability and strategic investment to produce desired results. Establishing the Trust for Healthy Maine is the best opportunity to ensure that tobacco settlement funding can continue to improve the lives of Maine people for years to come. I'm happy to answer any questions as the babies are still napping.
Thank you for your testimony, Kaylee. Any questions of her before she goes back to the twins? Glad you could work that out. Glad they cooperated.
So grateful for the flexibility, and thank you for taking the time to talk about this important issue.
Thank you. Representative Zager, would you care to introduce yourself?
Good morning again. Sam Zager, District 41 in Portland.
I
had to go dark to take care of something else in the house.
Okay. All right. That's what confused me. I'm trying to, too much going on. All right. Next, we'll go to the Honorable Linda Sanborn and welcome her to testify in front of the committee.
Thank you. Thank you so much. Good morning, Senator Claxton, Representative Meyer, and esteemed members of the Health and Human Services Committee. I am Linda Sanborn, a resident of Gorham, a retired family physician and state legislator. I am here today to testify in favor of LD 1523, an act to establish the Trust for a Healthy Maine. I want to express my gratitude to Representative Millett for bringing this important bill forward. In the 129th legislature, I served on the Appropriations and Financial Affairs Committee, and I was honored to be the Senate lead on LD 1961, a bipartisan bill sponsored by the Honorable Denny Keschel, which was unfortunately left unfinished in the spring of 2020 because of COVID. We knew then that a serious structural deficit in the Fund for a Healthy Maine was looming large. We also knew we were facing serious threats to our population's health and productivity, including trends in vaping, youth suicide, diabetes, opioid addiction, and infant mortality. Even before COVID, our children were facing new risks to their health, while employers were struggling to maintain and grow a healthy workforce. Like all states, Maine receives tobacco settlement payments because our people tried tobacco as kids, got addicted to nicotine as young adults, and in too many cases, got sick and too often died early as a result of their tobacco use. We can all name family or friends who've been lost to tobacco-related illness. That is why tobacco prevention, the tobacco settlement, and this bill that would restructure, stabilize, and modernize our use of the settlement transcends political party. I've attached an op-ed that Rep. Keschel and I authored 2 years ago. The story we told is as true today as it was then. We have a responsibility and an opportunity to act. Ignoring the structural deficit in the Fund for Healthy Maine until next year will only make it harder to solve. Inertia or inaction is not an option. We must challenge ourselves to step boldly into the future. LD 1523 takes a proactive, smart approach. It charts a course to a long-term solution by protecting the settlement for tobacco prevention and public health. Stabilizing and restructuring the tobacco settlement could jumpstart and sustain a modern, cost-effective system of public health. And when political and economic circumstances change, We will have a more evolved structure in place with built-in protections for ensuring this special revenue source is used as it was intended to prevent youth tobacco use and improve public health. Thank you for considering anew this important bill. I'm happy to answer any questions.
Thank you for your testimony. Good to see you again. Are there any questions for the Honorable Linda Sandmore? I'm not seeing any. A couple of questions from testimony that I think need to be answered during the course of the morning. Who's best positioned to explain the structural deficit at a high level and address the issue of whether this is doable or not according to the Constitution? So I just put those out there. I'm not asking that you answer them, but I want to make sure they were on the table for us to get answers to.
Yeah, and I think the answer to your first question is Carol Kelly. And I know that you have testimony from Attorney Fry, and I know that John Brodigan can answer those constitutional questions.
Great, thank you. I just want to get them on the table. Any other questions, comments related? Thank you for being here. Have a good day. And next we'll go to Ed Miller. Welcome, sir.
Good morning. Good morning, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. My name is Ed Miller. I'm a resident of Hollowell and a retired public health professional. I served for over 20 years as the executive director of the American Lung Association here in Maine. I've been advocating for funding for prevention from the Fund for Healthy Maine since it was created more than 2 decades ago. I'm pleased to appear here today in support of LD 1523, and I'll serve, I guess, as the role of a bit of a historian and context person on this for my testimony. A 1996 federal CDC study found that Maine had the highest young adult smoking rate in the United States. This finding sent shockwaves through the public health community in the state. Governor King and the legislature took immediate action by doubling the state excise tax on cigarettes and dedicating $3 million to support a tobacco control program within Maine CDC. This was Maine's first investment of state funds to address smoking. It consisted largely of a mass media campaign to educate the public about the problem and also to gain support for additional funding to implement a more comprehensive program. This additional funding came in 2000 from an unexpected event, the Master Settlement Agreement between the states and the major tobacco companies. The MSA was signed in November 1998. In April of 2000, Maine received its first annual payment of about $50 million to the Fund for Healthy Maine. As difficult it was to believe at the time, these payments were to be received in perpetuity. Annual payments are based on national sales volume of combustible cigarettes, and payments can also be impacted by disputes from participating manufacturers. Both of these variables are now coming into play in the current structural deficit within the Fund for Healthy Maine. You may hear that the settlement contains some special provision that favored spending these funds on Medicaid or healthcare in general. This is simply untrue. Despite the protests of much of the public health community, these funds went to states as completely unrestricted revenue. It may also be helpful to look at the original MSA document to get a sense of what the parties were thinking at the time. I attached to my testimony a 2-page MSA recitals section. There's not one reference made to medical care. There are, however, many points made about reducing youth smoking, restricting youth access to tobacco, and improving public health. Maine policymakers were solely responsible for determining the spending priorities of the new MSA dollars. They did the best job in the nation using these funds for tobacco prevention control programs. The fund created 9 program categories eligible for funding. Tobacco
30
prevention.
seconds, please.
Okay, I'll drop that and say, since it took time for the programs to become fully operational, fiscal year 2002 is a typical example of early legislative priorities. Of the 47 million spent, 13 million went to tobacco control and 6 million for Medicaid. However, by 2020, Medicaid spending reached 31 million and tobacco 10 million. So over this time period, Medicare funding increased 500%, while tobacco program funding decreased 24%. This was largely due to supplantation. Given the future projections from the MSA, you and other policymakers will need to strongly support the use of these unique funds, or they will be gone. Maine needs the Fund for Healthy Maine and the Trust for Fund for Healthy Maine need to be supported. and Maine Care needs to be supported through the general fund. I urge you to support LD 1523 as an innovative method to address this serious problem. Thank you very much.
Thank you, Mr. Miller. Are there any questions of this testimony? I'm not seeing any, so appreciate your being here. And now we'll go to Carol Kelly. Welcome.
Thank you so much, Senator Claxton and Representative Meyer, members of the Joint Standing Committee on Health and Human Services. My name is Carol Kelly, and I'm a planning and policy consultant in Portland. I'm working with Public Health Reimagined on this bill. We've been working on this for several years now, and we're so glad to be back talking with you all again, appreciating all the input you gave us on LD 1961, as Honorable Linda Sanborn told us. I'm testifying in strong support of LD 1523. And I just want to start by saying that my really very first job in public health was for the Maine Coalition on Smoking or Health. This was in the very early days of the tobacco settlement and the Fund for Healthy Maine. And with grant funding from the Robert Wood Johnson Foundation, we were able to help form and staff the Friends of the Fund for Healthy Maine. So 20 plus years later, many of those same friends will be speaking behind me today in support of this bill. This bill is both a response to the perilous financial situation of the fund that you've heard about, but also really an exciting opportunity to restructure and reboot the tobacco settlement in a way that honors its original intent. So I'll start by covering the financial situation. Here's a snapshot. In fiscal year 23 of the current biennium, we're going to be receiving about $44 million from the tobacco settlement, plus an additional $4 million in racino revenue, for a total of about $48 million that'll be flowing into the Fund for a Healthy Maine. But in that same year, we'll be spending about $55 million. We'll be allocating from the fund about $55 million. This is possible because of some carryover funds, but obviously there's a structural deficit right there. Of that $55 million baseline, that is the Fund for Healthy Maine, $31 million is allocated to Maine Care. And there's actually a total of $40 million allocated to the combination of Maine Care, Drugs for the Elderly, or DEL, Head Start, and Purchase Social Services. So those four lines take up $40 million of the baseline. And then starting in fiscal year 24, the problem really begins because the tobacco settlement revenue plunges to $31 million every year, or at least projected. So starting in fiscal year 24, 31 million coming in. I've now just laid out that we're spending 55 million in the baseline. Even with that little bit of racino revenue that flows, that 4 million, we're going to have 35 million to spend, and we're going to have 35 million available to spend and $55 million of a baseline to cover. So basically a $20 million a year structural deficit. And that's going to require either new revenue or cuts to programs in order to balance the budget. To put a finer point on it, starting in fiscal year 24, we'll be receiving only enough tobacco settlement dollars to pay for the Maine Care portion of the baseline in the Fund for Healthy Maine. There will be nothing left over for all the other prevention and public health initiatives that are so important to our public health efforts here in Maine. So we all support all of the things that are funded in the Fund for Healthy Maine, and we absolutely cannot ignore the looming
30 seconds,
financial
please.
crisis. For those of you who want a deeper dive into the spreadsheets, I'm happy to discuss this situation at any future point. But I just want to say that the complexity, it sounds like a complex situation. The solution is very straightforward, as was laid out by Representative Millett. We relocate the baseline. We move $37 million out of the fund into the general fund in the current biennium. We stabilize Maine Care, Head Start, Purchase Social Services, and the non-racino portion of DEL. And then we restructure the settlement from a fund to a trust. I just want to flag finally that the beauty of this model is that while a legislature can't bind a future legislature, a legislature can bind a trust. And so this is a perfect opportunity to automate full funding for the tobacco program, ensure an annual investment in health equity, and align the remaining settlement dollars with the highest priorities in our state health plan. So I will just close by saying that we believe it's a truly transformational approach. It not only resolves the structural deficit, but it builds a modern structure for the special fund It allows us to learn from the past and align with the challenges facing our kids and communities today. I hope you'll consider and support LD 1523, and I'd be happy to answer any questions.
Are there any questions of Carol Kelly? Yes, Representative Perry.
Thank you, Kelly, for your Carol, for your testimony. I do have a question, and I wish I'd probably asked Ed Miller, but wasn't there a period of time with budget cuts and stuff that the phone for the Help Me phone for quitting smoking actually got defunded?
Oh boy, Representative Perry, I wish I knew. I hate to say definitively. I mean, that sounds familiar, but in between the time where I told the story about working for the Coalition on Smoking Your Health and only a few years ago, I actually started working on substance use disorder and opioids in particular, and obesity and toxic chemicals. And I don't have a vivid memory of this. So I am quite convinced there's going to be people behind me who know the answer to this. And I hope it'll be okay with you that I'll opt not to put, to make a guess, because that's what it would be.
Thank you.
Yeah, sorry.
And if they can't, you're welcome to submit that to as testimony. Answer
oh,
that.
Good. Okay,
yeah.
That's great. Thank you.
Yeah, people can add testimony up until we're done with a work session. So there'll be time for that. Can you speak to what happens in subsequent years beyond the drop to 31 million in 2024?
Sure. The way that the revenue forecast works, we get a forecast for the next biennium. So we have a forecast of that 31 million in master settlement dollars coming in fiscal year 24 and 25, and beyond that we don't know. And so for sure. So, but I think that we can. I'll go out on a limb here and safely assume that with the vaping epidemic as it is, we're not going to see, these numbers are not going to dramatically rise again, because as Ed Miller said, this is based on national sales of combustibles, of cigarettes. So we have to assume that we're going to maintain this much lower level of resources for the fund, from the master settlement, and that this conversion to a trust and the relocation of the baseline of these bigger ticket items that are currently in the fund is really going to be the way that we stabilize everything and make sure it's secure for the future.
Thank you for that information. Any other questions? I don't see any. So now we can go to John Bradigan. Welcome, sir.
Good morning.
Good morning.
Senator Claxton, Representative Meyer, and honorable members of the Joint Standing Committee on Health and Human Services. My name is John Brodigan. I'm a resident of Falmouth, and I'm here today to testify in support of LD 1523 and 1693. For those of you whom I have not met, I served in the 122nd and 123rd legislatures, and I was honored to serve as House Chair of what's now called the Committee on Health Coverage, Insurance, and Financial Services, where I learned everything I needed to know about being a good committee chair from Representative Ann Perry. I also served as Assistant Attorney General in the Consumer Protection Division, which is the office that managed the tobacco settlement. Based on my experience as an attorney, a policymaker, and a state agency administrator, I believe that it is possible to create a successful structure to sustain an important public mission such as that contemplated by these bills. The essential elements would include a clearly defined mission, achievable goals, accountability, transparency, adequate resources, leadership, clear authority, and a verification of results. These can make a structure such as the Trust for Healthy Maine a success. Let me just make 3 brief points. First, a trust is legal and constitutional. We know this. It would not be the first trust in Maine law. Others are very successful for their respective purposes. It's a long-standing legal structure that functions every day. Second, the bill has a large number of comprehensive protections. Others are speaking this morning about the requirements for allocating of funds, which is a central purpose for which any trust is created. These thoughtful protections will work, but if the committee sees fit to adjust them now or in the future, that is possible. Finally, the necessary ingredients for complete success is the will to make it happen. In Maine, after all these years, the relentless scourge of teen smoking continues to quietly devastate Maine lives, burden our healthcare system, and drain our economy. If that suffering and tragedy doesn't provide the will to make this happen, I'm not sure what could. Ultimately, the success of a trust created by a public body depends largely on a shared consensus in the mission. I believe the Trust for Healthy Maine reflects both the spirit and the clearly articulated intent of the Master Settlement Agreement, which is plainly directed at reducing and preventing youth smoking and tobacco use through measures such as a ban on youth targeting, merchandising, free samples, and a commitment by all participating manufacturers to adopt a corporate culture to reduce youth access to tobacco and the incidence of tobacco use. It also
30
includes a
seconds,
ban on
Tom.
lobbying. Ultimately, the success of the Healthy Maine Trust depends on a strong consensus of support from all stakeholders. The very word trust captures the necessary element, a common commitment encoded into the strongest possible statutory language. It's not possible in a democracy to fashion a legal structure that will last forever. But the sponsors of this bill have performed an invaluable public service by working to cultivate that understanding. Thank you very much for the opportunity to testify.
Thank you for your testimony. Representative Meyer.
Thank you, Mr. Chair. Thank you, John, for being here today and for your testimony. In order to provide full accountability, we would want the trust to be transparent. What are the main transparency guarantees in this bill?
Yes, thank you very much for that question. The trust has very good transparency provisions. All of its meetings are open to the public under the open meeting laws. All of its documents are public records under the freedom of access laws. It's subject to constant oversight of this committee. It coordinates with the statewide coordinating council and other state agencies. It's required to provide its funding disbursement plan to the administration and to the legislature. It's required to produce a separate report for the administration and the legislature. It's audited annually by a CPA, and the report is provided to the legislature. In addition, the director of the CDC is a voting member of the Board of Trustees, and every member of the Board of Trustees is chosen by the governor and vetted by this committee and confirmed by the Senate, and each has a statutory fiduciary duty. So I think there's a whole range of things that are in the bill to protect and ensure transparency.
Are there any other questions of Mr. Browning? I don't see any. So again, thank you for being here. And next we'll hear from Rebecca Bullis. Good morning.
Good morning. Good morning, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Becca Bullis, and I'm a resident of South Portland and Executive Director of Maine Public Health Association. MPHA strongly supports LD 1523, an act to establish the Trust for a Healthy Maine. MPHA has a long-standing commitment to protecting and planning public health efforts in Maine, and most notably focusing on the Fund for a Healthy Maine, which is the repository for the state's tobacco settlement monies. As a follow-up to Ed Miller's earlier testimony, I included with my submission a historical review of the fund, which shows the diversions and supplantations that he discussed, and we published this just last year. When we started working on that report, which was in 2016, we saw those results of the diversions and supplantations and worked with our public health colleagues to identify potential strategies to protect and ensure consistency in public health program funding. We looked at Maine data, we looked at other states' public health modernization efforts. I talked with my colleagues in other states that serve in similar roles. And through this significant research and discussion, the creation of a trust to allocate monies received from the settlement was a clear opportunity. There are three main reasons that we support this legislation, and there are actually many reasons, but I'll focus on three in my testimony. The first is really around consistent program funding. Since the fund's inception, as you heard earlier, public health programs that receive support from the fund have seen dramatic shifts in their funding at the level of several $1 million. With shifts of this magnitude nearly every budget cycle, programs are either having to scale back by firing staff, scrambling to find other sources of funding to maintain their programs, or closing altogether. At the other extreme, programs either scale up very quickly to meet funding timelines, or if they're unable to do so, they cannot accept that funding, which then in turn hurts Maine communities. This is not responsible public health policy and is an inefficient way to deliver much needed public health programs to Maine people. This funding approach also creates sizable gaps in services, with even greater losses for populations that are already experiencing health disparities. The Trust's assurance of consistent funding for public health programs and the nimbleness to respond to emerging public health threats improves program delivery and associated health outcomes because there are no longer those extreme peaks and valleys in funding, staffing, and program availability. The second reason that we support this trust is because of the annual investments and the systems and structures necessary to achieve health equity. Through investing in community coalitions, the public health workforce training, and data collection, analysis, and reporting, we strengthen our public health infrastructure across areas with an explicit central focus on improving health equity and reducing health disparities. And the third reason is around alignment with funding for the state health plan. The state health plan identifies data. Thank you. The state health plan identifies data-informed public health priorities and creates a multi-year plan of objectives, strategies, and outcomes for statewide action. To date, there has not been dedicated funding for Maine State Health Plan, which impairs our responsiveness to Maine's public health needs. LD 1523 takes a planful approach to investing in public health challenges and accordingly allows us to make greater inroads in addressing Maine's public health needs. My final 3 points, and I include these in our testimony, is that in 2019, we received funding from Maine Cancer Foundation to conduct a public opinion poll. And in those data, you'll see that Maine voters strongly support the creation of a trust. We know from data from the Trust for America's Health that we see a greater return on investment when we invest in chronic disease prevention. And the last is that I just want to say that this is a priority for the association. We are the state's largest association for public health professionals, and we've been working on this for several years. Our board voted unanimously in support, and I just strongly encourage you to please support this legislation. I'm happy to take any questions now or before the work session, and I'll certainly be there if any come up then. So thank you again for hearing our testimony, and I'm happy to take any questions. Thank you.
Thank you for that. Are there any questions for Becca? I'm not seeing any. So again, thank you for being here. We'll continue to hear from folks in support by going to Jamie Comstock.
Hi, good morning. Thank you. Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Jamie Comstock, and I'm the Health Promotion Manager at the City of Bangor's Public Health and Community Services Department. I'm providing testimony in support of LD 1523. I come before you after contemplating the collection of bills this session, some looking to expand the reach of the tobacco industry and some looking to expand the purview of the cannabis industry. On the surface, it may appear as just another legislative session, but what makes this one different is the backdrop. In 2021, we lost over 636 Mainers to overdose, which is a 23% increase from 2020 and a 300% increase since 2010. Over 90% of recently surveyed Maine school counselors report increases in depression and anxiety in their schools, and well over half of those families are facing housing and food stressors. The expansion of industries like tobacco, cannabis, and alcohol, and complex problems like houselessness, mental health, food insecurity, and substance use disorder are all interrelated and interconnected. And finally, our current public health and prevention system is too frail to address these issues. LD 1523 gives us a chance to strengthen our public health system for the benefit of all Mainers. It allows for long-term planning beyond a 2-year budget cycle. This has been one of the biggest barriers in our work since I started in 2007, making every aspect of program planning difficult, from recruiting and retaining staff to maintaining a reliable and trusted presence within local communities. LD 1523 guarantees an annual investment in health equity systems and infrastructure, in workforce development, training, and technical assistance. It allows us a chance to get out ahead, to make data-informed decisions, to allow local communities and local partners to address local issues that will have impact. And most importantly, it guarantees the first priority for settlement dollars in preventing tobacco use and nicotine addiction in Maine children and adults by funding Maine's tobacco program at US CDC recommended levels. We will never be able to invest in prevention what the tobacco industry spends here to promote its products, but this is a solid start. LD 1523 lets the people of Maine know that we are in it for the long haul. Thank you for your time and attention, and I'd be pleased to take any questions.
Thank you. I'm not seeing any questions. So now we can go to Julie Daigle. Good morning.
Good morning, distinguished members of the Joint Standing Committee on Health and Human Services. My name is Julie Daigle. I work as a public health professional for Healthy Acadia in Hancock and Washington counties, and I have a house in Overstick County. I'm testifying here in support of LD 1523 and LD 1693. With the creation of the Fund for a Healthy Maine in 1999 from Tobacco Master Settlement monies, Maine had a strong start in health promotion and disease prevention, but we have not lived up to that early potential. In our current situation, as much as 70% of the Fund for Healthy Maine monies are going to medical care. And as we heard, with an upcoming deficit in revenues versus allocations, the outlook for prevention funding is even worse. We should not borrow from our future health by deprioritizing public health efforts that reduce chronic disease. That's an expensive strategy. The Fund for a Healthy Maine was created to remedy the costs and harms of tobacco use, which means in great part the chronic disease that results. And while it's very easy to think of tobacco as a problem that's been solved already, or to think of it as relatively benign, we forget the basics. It kills nearly 500,000 people per year. That's more than alcohol, AIDS, car crashes, illegal drugs, murders, and suicides combined. There's a huge financial cost associated with it. In Maine, the direct healthcare costs alone are about $800 million per year. Furthermore, the percentage of kids who are using vaping devices, these are also called e-cigarettes, is sky high. They're vaping at much higher rates than they ever smoked cigarettes. Nearly 1 in 3 Maine high school students were vaping in 2018, 2019, and current estimates are even higher. We don't know for certain what the long-term impacts of this will be, but we know that it won't be nothing. And we know that flavorings in vaping liquids, so this is part of the delivery mechanism for nicotine in e-cigarettes, are strong incentives for youth to use. Along with the increased use of nicotine comes an increase in addiction and an increased risk of the use of other addictive substances. Tobacco use kills slowly, and it kills in hidden ways, so it's easy to overlook. It also has powerful support from tobacco company advertising. Given that tobacco companies are spending about $46 billion annually in Maine to promote its use, it's critical to fund tobacco use prevention at the minimal amount recommended by the CDC. To create positive change, we need to do 2 things. Restructure the tobacco settlement to create the Trust for a Healthy Maine and stop the flavored tobacco. This will protect our investment in the current and future health of every member of the public in every county in Maine, and will help build sustainable, connected, and healthy communities. Thank you so much for the opportunity to speak in front of you all.
Thank you for that testimony. I'm not seeing any questions, so we can go to Judith Feinstein. Good morning.
Good morning, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Judy Feinstein. I serve as the coordinator of the Maine Oral Health Coalition, and it's nice to see you all again. I hope you're as well as you look. Founded over 20 years ago as the Maine Dental Access Coalition, we maintain a close interest in policy and systems changes that can work to improve access to services and oral health status in Maine. We support LD 1523 in its intent to establish a trust, and I'm not going to go into all the reasons. You've heard them and you will hear more. The trust is the best way that this money can have the most impact. Its proposed duties enable it to remain nimble and responsive to changing needs while prioritizing public health investments. And it would build on the experience and successes of what we have already accomplished without the specters of budget cycles and lower payment projections. So why the Oral Health Coalition? We've been involved throughout the life of the fund with a particular interest in the Maine CDC's oral health program and the dental education loan and loan repayment programs that are administered by FAME, the Finance Authority of Maine. I have personal experience with both through my former position as the manager of the Maine CDC's oral health program. So I was overseeing the school oral health program and also helping to design and implement the loan repayment programs. Over the years, we've seen many of the preventive programs and initiatives that were supported by the fund suffer or be diminished by decreased allocations and the constraints of the two-year budget process. There comes a point, and in the oral health program, we absolutely experience that, and Kaylee has spoke to this. There comes a point when all the corners have been cut and programs become less effective and less able to meet their intent. Funding shifts have had an adverse impact on that program, on the school oral health program. My sense is that FAME has made their allocation work, but the need that the dental loan programs address is as great as ever, and perhaps more so in 2022 than when the program began 20 years ago. Excuse me. When the Fund for Healthy Maine funding began over 20 years ago, and then since then, those dollars have been key in efforts to address tobacco prevention, but also health equity, social determinants of health, and Maine's public health infrastructure. Even though those phrases weren't explicitly in our vocabularies at that
30
time.
seconds, Judith.
Now they are, and as our understanding of those phrases, of those words continues to evolve, we maintain that they and other non-tobacco specific programs are more important than ever, and they are all interrelated. So we urge you to support LD 1523. I will be back a little bit later to talk more with more examples about oral health on 1693. I thank you for your consideration. I'd be very happy to respond to any questions now or at the work session. Thank you all very much.
Thank you, and thank you for your service over the years. I don't see any questions, so let's go to Lisa Miller. Welcome.
Good morning, Senator Claxton, Representative Meyer, esteemed members of the Joint Committee of Health and Human Services. I'm Lisa Miller. I live in Somerville, and I'm a member of the Public Health Reimagined group. My testimony to you is going to be from the perspective of a former legislator, and I served on your committee years ago. I served on appropriations, and I couldn't figure out a way to get you a gift coming back before your committee. No chocolate this time, but I'll give a donation to the food bank. So I know, like you, what it's like to be bombarded with numerous good ideas about how to use ever declining settlement funds. And then those ideas parade before you, and you're expected to be experts on, public health issues like lead poisoning, vaping, vaccines, opioids. It can get confusing. You've witnessed over years this movement of funds, supplantation of settlement dollars, backfilling general fund monies. And it's something the fund was never intended to do, whether you knew that historically or not. So now you have before you this new approach, this new bill, LD 1523, a reworked version of an old bill, to be honest. And as Becca Bolas said in her MPHA testimony, this has been enormously well researched over the past 6 years, I think, at this point. So the issue before you, I think, right now is that you have the Fund for Healthy Maine, which is an aging structure, and it's dated, and it's now firmly challenged by this structural gap. What you have is an opportunity to look for the next 20 years and redo this structure. And I know as a legislator how constraining the 2-year budget cycles, the 2-year election cycles, the 2-year legislative cycles can be. And it's really hard to think ahead. But this is your moment, I think, to break those shackles and to really be way more forward thinking than prior legislatures, to be honest. You can create an important public health funding structure that is more nimble, it's more data driven, and it's more accountable. So I urge you to support LD 1523. Thank you.
Thank you. Are there any questions for the Honorable Lisa Miller? I don't see any. Again, thank you for being here. Let's hear from Morgan Hind.
Good morning, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Morgan Hind. I'm from Warren, and I am the director of the Bingham Program, a charitable endowment held at Tufts Medical Center, established in 1932 to promote health and advance medicine in Maine. And I actually took Lisa Miller's place at the Bingham Program after she retired a few years ago. So the timing of having us testify right next to each other is good. The Bingham Program has been a longtime supporter of efforts to improve community health through strategic investments in public health policy and programs, particularly those that address adverse childhood experiences and build resilience in Maine's children, families, and communities. That's why the Bingham Program is supporting LD 1523. Establishing the Trust for a Healthy Maine will strengthen public health in the state far beyond what philanthropy can do, and will protect critical public health programs for generations to come. In the last 2 years, Maine's public health infrastructure has been tested like never before. Local public health staff have been stretched beyond their limits, leaving gaps that independent community members were fortunately inspired to fill. Without the many volunteer groups that formed to meet the public health needs of their communities, Maine's insufficient local public health capacity to respond to the COVID-19 pandemic would have been even more starkly exposed. And in my submitted testimony, you'll see a link to an article about those local volunteer public health task forces that I encourage you to take a look at. We continue to rely on the volunteer efforts of community members to shore up our public health infrastructure. We must create a solution to the underfunding of public health in our state that has plagued us for far too long by creating a sustainable funding structure that will allow us to robustly plan for and respond to the challenges of the next public health crisis and the one after that. We have an opportunity to do this with the passage of LD 1523. Establishing the Trust for a Healthy Maine is the perfect companion to the one-time federal investments that are currently being made in public health infrastructure and workforce. Combined, these short and long-term investments create the perfect recipe for the statewide and community-based public health system our state so desperately needs. While we all know how critically important it is to have access to medical care, we also know that unless we begin to focus more on primary prevention, we will be stuck in an endless, costly cycle of treating preventable diseases.
30 seconds, Morgan.
Thank you. The Trust for a Healthy Maine will also make the Maine Care Program more sustainable and affordable in the long run because it allows us to increase our investments in disease prevention and health promotion. If we do nothing to resolve the looming structural gap in the Fund for a Healthy Maine, every prevention and treatment program we care about will suffer. But if we act now with an eye to the future while learning from the past, we can stabilize medical care in the general fund and free up the tobacco settlement for its original intent, building strong, resilient communities that raise strong, resilient kids. We know that a trust can succeed in Maine. Efficiency Maine provides us with a model for how to manage a trust well and achieve the long-term goals we set for the trust. The experiences of other states use of trust are informative, but they are not predictive of how a trust informed by lived experience will perform in Maine. We don't need to look to other states to see if this can work. We have the perfect example right in our state that shows that it can. LD 1523 is about improving the health and well-being of Maine people and Maine's economy because we know that investments in public health improve outcomes for families and businesses alike. We must be prepared to address the unrelenting threats to health and productivity in our state to allow Maine's economy to thrive. We can do this by stabilizing funding for public health and protecting that funding for years to come. The Trust for a Healthy Maine will ensure more focused, data-driven priority setting for tobacco settlement dollars informed by people with lived experience. Thank you for your consideration of this critical piece of legislation and happy to answer any questions.
Thank you for your testimony. I'm not seeing any questions, Morgan. So we'll go to Sean Yardley. Welcome.
Thank you. Senator Claxton, Representative Meyer, esteemed members of the HHS committee. My name is Sean Yardley. I reside in Bangor, and I am the CEO of Community Concepts in Lewiston. I'm here to testify in strong support of LD 1523. As the former director of the City of Bangor's Public Health Department and past president of MPHA, I have been very involved with the Fund for Healthy Maine and actually served with then Senator Craven on the 2011 commission to study allocations of the Fund for a Healthy Maine. The focus of that commission then was the very issues being discussed today. Here we are over 10 years later, struggling with the impact of supplementation that is problematic for many reasons. Unstable funding, been mentioned several times already, and one that's really important is creating and maintaining opportunities to attract interested and qualified workforce. With the unstable funding, unpredictable every 2-year cycle, it is very hard to recruit, hire, and retain a workforce. That is a significant issue. This, in my experience, the programs that have been funded through supplementation are really worthwhile programs, and they deserve public funding. But the scenario that's set up with this every 2-year funding cycle creates a perpetual competition among vital services where we can't afford to have winners and losers. I urge you to pass LD 1523, and I would urge you also not to let perfect be the enemy of the good. This is new, it's different, it requires thoughtful consideration, but what we must, and you've heard already, known for many years, there exist flaws in the current approach. Now is the time to address those flaws. Thank you.
Thank you. Okay, I don't see any questions. Thank you for being here. I notice we've been joined by Representative Javner.
Thank you, Senator Claxton. Good morning, everyone. I'm Representative Kathy Javner. I represent House District 141, which is located in Penobscot and Washington counties.
Thank you. And Representative Madigan's here.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Great. Thank you. So that is the last of the speakers in support of this bill that I'm aware of. If you'd like to say something in support of the LD 1523, I'd ask if you're an attendee to put your hand up. I see one hand already, so we'll be moving in Kathy Kilrain Del Rio and also Hannah Hudson. So they'll have a chance to testify. And then when we've heard from all those in favor, we'll go to those who are speaking in opposition and those who are speaking neither for nor against. So welcome, Hannah Hudson.
Thank you, Senator. Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Hannah Hudson. I'm originally from Columbia Falls and currently serve as the Policy and Communications Manager for the Maine Primary Care Association. MPCA is a membership organization that includes all of Maine's 20 federally qualified health centers, also known as community health centers. Maine CHCs make up the largest independent primary care network in the state, providing comprehensive medical, behavioral, and dental care for more than 200,000 individuals, or 1 in 6 Maine people. They are at the forefront of delivering care to rural and underserved Maine communities and serve patients regardless of their ability to pay or health insurance status. The Maine Primary Care Association supports LD 1693 and LD 1523, and thanks representatives and senators for bringing this bill forward. This bill aims to provide a necessary solution to the financial challenges facing the Fund for a Healthy Maine and creates a pathway for systemic structural change that will benefit public health in the state. We strongly support efforts to build and sustain a modern, cost-effective system of public health, and establishing the Trust for a Healthy Maine and restructuring tobacco settlement funding would guarantee annual investment in the systems and community-based infrastructure necessary to achieve health equity. CHCs are on the front lines of providing health care in Maine and serve the most vulnerable populations in our state. Programs currently funded through the Fund for a Healthy Maine to address nicotine addiction, obesity, oral health, and substance use disorders, among many others, directly align with the work that they are doing. It is imperative that we find a long-term workable solution to ensure that continued financial support is available for these programs. LD 1693 provides an important opportunity to ensure that the tobacco settlement funding will continue to benefit the lives of Maine people. And on behalf of Maine's community health centers, thank you for considering our comments in support of establishment of the Trust for a Healthy Maine. Thank you.
Thank you for being here. I'm not seeing any questions, so we can go to Kathy Kilrain Del Rio.
Thank you. Good morning, Senator Claxton, Representative Meyer, members of the Joint Standing Committee on Health and Human Services. My name is Kathy Kilrain Del Rio, and I'm the Advocacy and Programs Director for Maine Equal Justice, a nonprofit legal aid provider working to increase economic security, opportunity, and equity for people in Maine. Today, I am testifying in support of LD 1523 as amended. A robust healthcare system that will ensure all Mainers with low incomes can lead healthy lives requires an investment in both public health prevention programs and comprehensive Maine care services. For that reason, Maine Equal Justice has long been a partner with members of the public health community in supporting the Fund for a Healthy Maine. We recognize and support the need to fund the projected shortfall in the Fund for a Healthy Maine to ensure needed prevention programs and other critical public health services continue at current rates. In the past, we've expressed concerns that the solution before you today would solve one problem while creating another for Maine Care, Drugs for the Elderly, Head Start, and other necessary programs. However, it is our understanding that the amendment proposed by the sponsor today will move the funding for these programs to the baseline of the budget. With that change, we can support LD 1523 as amended. I'd also like to express appreciation for the recognition of racism's impact on health and the creation of Health Equity and Health Improvement Account. As the US CDC notes, a growing body of research shows that centuries of racism in this country has had a profound and negative impact on communities of color. The impact is pervasive and deeply embedded in our society. It affects where one lives, learns, works, worships, and plays, and creates inequities in access to a range of social and economic benefits, such as housing, education, wealth, and employment. These conditions, often referred to as social determinants of health, are key drivers of health inequities within communities of color, placing those within these populations at greater risk for poor health outcomes. The results of these inequities are higher rates of illness and serious health problems for Black and Brown Mainers than for white Mainers. We saw this most recently when Maine had some of the highest racial disparities for COVID-19 in the nation. To reduce these types of disparities, we must create new systems to confront the systemic racism embedded in our healthcare system and so many aspects of our lives. This bill seeks to do that for our public health system. Thank you for the opportunity to speak about this bill, and I'm happy to answer any of your questions and can also be available for the work session.
Thank you for being here. I don't see any questions, so let's go to Joanne Joy.
Good morning, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Joanne Joy, and I live in Bowdenham. I'm representing the Maine Network of Healthy Communities today in support of LD 1523. I'm one of the founding members of the Maine Network, which began 20 years ago. We had some community health coalitions that were roughly founded on the World Health Organization's healthy community model. So it really relied on people in the community identifying their own needs. At the time, those groups got like $5,000 to $20,000 a year in a competitive grant application. That was, before the Fund for a Healthy Maine. There were a dozen of these groups around the state, and they had like a really wide range of priorities. A reducing litter and recycling or immunizations, water. It was great in the fact that they got local input and local people engaged, but it did nothing to improve the state overall in their public health status. So those early coalitions were great, but we really needed a system. We really needed some funding. We really need some priorities. And the Fund for a Healthy Maine, as created by the 119th, really did that. It created a plan and a way to fund a wide range of things that really impacted the most number of people and the most expensive diseases and the most preventable diseases. I'd like to say that everything's perfect, but of course there was no way to really deal with the vaping issues because it fell outside the master tobacco settlement restrictions, et cetera. But we did let our eye off the ball for a lot of reasons. And we now have a lot of kids addicted again to tobacco, to nicotine. So let me move on in that addiction to tobacco by vaping no longer helps fund the settlement. So this huge dive doesn't mean we really succeeded in getting rid of tobacco's addiction. What the tobacco company succeeded in doing is going around the issue around smoking. So that's why the drop in the funds, and I'm sure you've heard that before, it's because people don't smoke, they vape. But we have lots of people who are really still addicted to tobacco through the vaping process. So we know that 20 years of tobacco prevention really did improve people's lives. I mean,
30 seconds, Joanne.
Thank you. What I would like to look at is that what this does is go back to keeping the master tobacco settlement in tobacco prevention. It's still the #1 prevention piece. It does move to a trust structure with experts kind of helping us map what now should be the map for the tobacco settlement funds. We could not have predicted COVID. We could have not predicted opioids. We didn't predict vaping. And now we know prevention saves money, and we should have a modernized, responsive public health plan and trust. Thank you for your time.
Thank you for your time and your service. Thank you for your testimony. Next, we'll go to Megan Hannon.
Good morning, Senator Claxton, Representative Meyer, and members of the Committee on Health and Human Services. I am Megan Hannon, the Executive Director of Maine Community Action Partnership. And although we've had some reservations and are taking a risk, we support LDs 1523 and 1693 as amended. For more than 50 years, community action has served as a dynamic and community-based force in addressing the causes and conditions of poverty throughout Maine and in the country. Our 10 community action agencies deliver programs and services for people with low and moderate income, including the Home Energy Assistance Program, Workforce Development, Current Rental Relief Program, Head Start, and more. Above all, our mission is about equity, economic opportunity, education, and the opportunity to succeed. Like many you've seen this morning, I personally have a rich history as an advocate for the Fund for Healthy Maine. We used to call ourselves the Friends for the Healthy Maine. In 1999, when the Master Settlement Agreement was signed, before any funds made their way to Maine, I was active working with many public health partners, creating the fund to ensure all of the MSA funds went to public health, disease prevention, a local infrastructure, and especially anti-tobacco efforts. I was the Director of Government Relations for the American Cancer Society at the time, and so my commitment to public health has not changed, even though I've changed employers since then. Head Start and Early Head Start were included in the original slate of programs of the fund because Head Start is primary prevention for students and their families. Among other ways in which this is true, each student is assessed with the early and periodic screening, diagnostic and treatment, or EPSTD, a Maine care benefit that provides comprehensive and preventive health services for children. Most of our students are indeed Maine care members, and we use the funds from the Fund for Healthy Maine specifically to do this at our Early Head Start programs. Moving these funds to the general funds is certainly appropriate, and we support that in general. We're concerned, of course, about the fact that what goes into the general fund can be removed. Of course, that's also true in the Fund for Healthy Maine. You may not be aware, but the state does not appropriate much money to Early Head Start or Head Start programs. These funds within the fund, combined with another small amount from TANF and contracted general funds, which are also in the fund, comprise a very small fraction of funds to run some of the most cost-effective, proven early care and education programs in the country. With more state funds to support, we could offer programs to more Maine families. For that reason, the Maine Head Starts Directors Association will be working on a campaign to better fund those programs in the near future. Head Start is an income-tested program, and the good news is that as more people are being paid more between our higher minimum wage and the pandemic wage increases. But the concurrent bad news,
Megan.
thank you, is that families are now just above income guidelines, meaning they lose Head Start care. For further parts in LD, especially 1693 that we support without equivocation, Office of Population Health Equity is already in place, and we hope it is supported financially and politically so we can begin to reverse the true health inequity we saw during the pandemic of the past 2 years. We also continue to support the development of the public health workforce infrastructure. Again, we saw the lack of such an infrastructure meant during our time of urgent need. What had been the Health Humane partnerships, locally governed and operated coalitions throughout the state would have been the go-to organizations to set up COVID vaccine clinics, testing sites, and to push our social and traditional media. But they had been unfunded for years, leaving other organizations like my own to pick that up. So I won't read any more, but thank you for your time and consideration. I'm happy to answer any of the questions that you have.
Thank you for your testimony. I'm not seeing any. I think we've heard from everybody testifying in support of this bill. If that's not the case, I'd ask you to put your hand up. And I see one person who's got a hand up. Let's admit two more to go. And I'm going to turn the chair over to my co-chair for a few minutes. Thank you.
Thank you, Mr. Chair. So up next, we have Stephanie Eglinton. Welcome.
Thank you. Good morning, Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. My name is Stephanie Eglinton, and I'm Executive Director of the Maine Children's Alliance. We are a statewide nonpartisan advocacy organization whose mission is to promote sound public policies to improve the life of Maine's children, youth, and families. And I offer testimony in favor of both LD 1523 and LD 1693 to establish the Trust for a Healthy Maine, as well as the other provisions in the legislation to advance prevention and equity for the health and well-being of Maine's children. The establishment of the trust, as you heard, will create a more consistent oversight and implementation of run through a board of trustees and would be allocated primarily to support the original intent of this settlement for tobacco prevention at recommended levels and tied to the state's health plan prevention efforts to respond to establish an emerging public health threats. And these threats for children and youth in Maine include vaping and nicotine addiction, trauma and toxic stress, substance use disorder, and obesity. As we reported in the 2021 Kids Count data book, while youth cigarette use is on the decline in Maine, e-cigarettes or vaping are sharply on the rise. Maine has mirrored the nation with youth vaping rates doubling in the state from 15.2 to 30.3%. Between 2017 and 2019. The elimination of flavored tobacco products and increased investment in tobacco prevention efforts are important tools to mitigate this threat to the health of Maine youth. And child obesity is a serious problem in the United States, affecting 1 in 5 adolescents. Prevention and early intervention with children and families is critical to reducing the prevalence of obesity and its negative health implications and costs. I did want to note that related to the obesity prevention standards in early care and education, while the Maine Department of Education administers the Child and Adult Care Food Program, we would assume that the rulemaking related to physical activity, screen time, and sugary drinks would fall to the Department of Health and Human Services as they administer the child care licensing. Another important component of the legislation is the focus on health equity. Through the trust, annual investments will be guaranteed on both state and community level public health infrastructure to ensure that health equity is a priority and is achievable across the state.
30
Finally,
seconds.
I would just like to point out too that since 2001, Head Start has been one of the core programs receiving support through the Fund for a Healthy Maine. It is one of the most effective programs for giving young children a strong start in life, yet only 39% of eligible children in Maine can access the program because of lack of funding. Our understanding is that the amendment proposes to transfer the $1.3 million from Head Start from the Fund for Healthy Maine to the baseline of the general fund. We support this amendment, but strongly urge the state to retain its commitment to funding Head Start at this level or more. Thank you for your consideration.
Thank you, Stephanie. Questions from the committee? Seeing no hands up, appreciate your being here today. Madeline, am I seeing Madeline DeFazis?
She put her hand up too soon and is now an attendee and will testify in LD 1693.
Okay, thank you, Karen. Appreciate that. Does that conclude the testimony on 1523? I'm sorry, I've got a lot of screens going.
That concludes the 4. Now we'll hear from a couple of voices against the bill.
Okay, and you are back, so I will let you take over, Senator.
Thank you very much. So we'll hear from Christopher Hodgkin and Leo Delicata if they are in the attendee category.
I have asked them to accept promotion.
Very good. Thank you. Good. Welcome, Leo Delicata.
Thank you, Senator Claxton. Senator Claxton and Representative Meyer and members of the Health and Human Services Committee. My name is Leo Delicata. I'm a lawyer with Legal Services for the Elderly. And we represent people over 60 and provide them with free legal service when their basic human needs are at stake and they have legal issues. Some of our clients, 38,000 people actually, are going to be affected by this piece of legislation. And so we're here to speak on it today. It pains me, and it's very difficult for me to speak against a bill that so many of our partners and so many of the advocates that we've worked with over the years have testified in favor of and support. But we're here because we disagree with the policy direction that this bill takes us. And we believe it will seriously disadvantage our clients and the 38,000 older adults that are in the MSP and the Dell program that are within the medical care line of the budget for the Fund for Healthy Maine. So let me just say a couple of things. The bill, as we read it and has been portrayed, essentially removes control of the legislature from any decisions with respect to any of the issues or any of the programs or any of the policy directions that will be now handled by this Fund for Healthy Maine. You have oversight, but that's undefined. The trust itself is essentially autonomous, although they have reporting responsibilities and they have responsibilities to include various parties within their informational structure. But bottom line is they get to call the shots. This is really different. Essentially what this means is that after 2024, that all of the main care account, all of the MSP, all of the Dell, all of the Head Start, all of the child care accounts will go into the general fund and will have to compete in the general fund with all the other interests, rather than being in the Fund for Healthy Maine and having a discrete number of very worthy choices and programs to make funding decisions about. You know, the MSP and the Dell program are very, very incredibly leveraged programs in the main care program. What happens is that those programs that affect those 38,000 people, they go into the main care program with either Racino, well, actually with tobacco money, which is not from the taxpayer, and it gets matched with federal money. Right now, it's a 70% federal match. And what that buys is it buys coverage for the premiums, the deductibles, the co-payment, the co-insurance, and the prescription drug costs for people on Medicare who qualify for the MSP program and the Dell program. Now, some of you who are over 65 understand that Medicare is not free. And if you go to the hospital, you're going to have a huge deductible. And that's why most of us have supplemental insurance. Okay. So that is now, those programs are now going to have to compete in the huge Medicare budget rather than in the huge general fund budget, rather than staying in the Fund for Healthy Maine. The
30
other
seconds, Leo.
Okay, for 30 seconds, the last point that I want to make is the narrative that the Master Settlement Agreement was directed towards children and prevention programs is incomplete. It's an incomplete narrative. In my testimony, you will see that the recitals that Ed Miller mentioned, one of them specifically mentions the secure money payments to the states. That's money, and getting money from personal injury lawsuits is what lawyers do, and that's part of the recital. But I also want you to look at page 4 of my testimony, which talks about the Tobacco Manufacturers Act. And what that is, it's a piece of legislation that was in the Master Settlement Agreement. It was a model act. It was adopted by the state of Maine, and it sets out in very graphic details why the suit was brought, we believe, and why people who didn't settle, manufacturers who didn't settle, would have to set up contingency accounts in case they were sued by the state and they go out of business. And it is.
Oh, we just lost your audio. Mr. Delicata, we just lost your audio.
Technology. It specifically says that smoking causes cancer. It tells you what diseases it causes. And it basically says the people who cause these diseases have to pay. And that's what the Medicare, that's the main care line in the budget of the Fund for Healthy Maine is all about. It's about paying and helping people to pay for those diseases that they got from smoking. So please, that's the narrative. It's not that the Fund for Healthy Maine is for kids. It is, but there are a lot of other considerations that were made at the beginning, and I hope you keep them in mind. And I will be here at the work session if anybody wants to know any more about the MSP program or the Dell program or anything else in the Master Settlement Agreement or this other agreement. I'll be happy to talk about it. Thank you.
Thank you, Mr. Delicata. I see a question from Representative Zager.
Thank you very much, Mr. Chair. Mr. Delicata, thank you so much for testifying today. I recognize the dilemma that you expressed at the beginning of your testimony. Can you please help me understand? Because my understanding from the Master Settlement Agreement is that the primary purpose for the settling states was to decrease youth smoking and promote public health. Or at least as the Public Health Law Center describes. I'm not a lawyer.
Yeah, well, you can read the recitals if you want. I mean, Ed Miller probably, I'm sure he presented all of them, and if he didn't, we can do that for you. It certainly does mention the cessation of smoking for children. It mentions public health. Now, I don't know what you think public health is about, but if treatment of disease is not public health, then I don't know what is. It's part of it. And it also mentions specifically money for the settling states. It doesn't say money, what the money is for, but it's a personal injury case. It's a way of getting a remedy for harm to the people who have been smoking and the people who might be smoking. So to say that it's just for children or the priority is children, there's nothing in there that says they're a priority. The Fund for Healthy Maine, if you look at the Fund for Healthy Maine language, if children were a priority, if cessation smoking cessation was a priority, you wouldn't have in the Fund for Healthy Maine a specific budgetary requirement that if the allocations are not what are budgeted, that the rest of the general allocations, then the rest of the allocations in the Fund for Healthy Maine, the allocations for each program are going to be reduced by the ratio that the individual allocation corresponds or is compared with the entire amount. They tried to keep it fair. They tried to make sure that everybody was treated fairly. One of the things that really, really bothers me about this is it's not fair. This trust takes all of the money, all of it, at least $30 million, and in sometimes more, and will dedicate it to the cessation of smoking and also preventative programs for tobacco and other, not other substance abuses, but tobacco related. So the idea, the narrative that the master settlement agreement was designed for prevention is just incomplete. And I'm really sorry, but that really disturbs me. And so thank you for the question. I
didn't ask it yet, actually.
Oh, well, sorry.
Representative Zager, did you have a question for the?
I actually, you sort of answered some of it, but I think what I'm understanding is that you take issue with the characterization of the Public Health Law Center in saying that the primary purpose of the settling states is to decrease youth smoking and promote public health, or at least you take issue with what the phrase public health means to include treatment of disease. Is that?
I think there's I think there's no evidence to show that that's the primary purpose of it. It certainly mentions it. If it was the primary, I think there would be better language in the agreement, but for the fact that, when you're doing a settlement agreement and you've got somebody on the other side that won't even admit that they've caused the harm, but wants to settle it, you're going to be careful about your agreement, what you write. That's why I think that the model agreement that's in Exhibit T in the master settlement agreement, and I talk about it in my testimony, is important, because that's an agreement that the lawyers for the plaintiffs drafted. It had nothing to do with input from the defendants. And what they're saying in that agreement is, look, you guys, we understand that what you did causes smoking. It causes cardiovascular disease, it causes lung diseases, it causes other diseases. We know that we have an obligation as states to use public money to pay for the treatment of those diseases, and that people may be entitled to having us do that. And we want to make sure that you pay. That's what that agreement does. And Maine adopted that agreement. So I'm only saying this because it gives you a way to look at the master settlement agreement as incomplete with respect to what they wanted to say. You have to look at the whole agreement, and part of it is the exhibits. So I'm not trying to say that people who represent, or programs that represent public health or smoking cessation or anything else related to that have been treated fairly, have been funded adequately, have been respected over the years. They have not. This is their attempt to put the money in a lockbox so that it can't be touched. And you can't do that because you cannot bind a future legislator. And that's why they've been treated unfairly. They have not gotten the money that they deserve to get and they should get. And when decisions are made in the middle of the night and they're hard decisions, they end up losing. We end up losing sometimes. There are many times our programs get cut within the Fund for Healthy Maine. We have to battle back every time, and it's very difficult. We know what it is to be attacked, and that's why, again, it's so difficult for me to be here. It's so difficult for me to make arguments against this, but it's not fair. It's wrong. You shouldn't pass it.
Thank you for that. Representative Craven, did you have your hand up a bit ago?
Thank you, Mr. Chair. I did. Hi, Leo. Thank you for your testimony. So I guess I wanted to ask if you had any other solutions or any other thoughts about preserving the fund and for it not to just be up for grabs for any kind of hole that's left in the budget at any time. I'm a big supporter of both those programs for the elderly and have, always supported them and worried that they might lose money at some point. So I just wondered if you had any other thoughts about how to preserve and the fund.
I do. And it's not to preserve the fund, but to address the need that's behind the effort to do this to the fund. It occurs to me, it's always occurred to me, that tobacco is an addictive substance. We're talking about addiction in the same way we talk about substance addiction. We have an entire initiative now with a wonderful leader that deals with addiction and opioid addiction problems. There's just been a huge lawsuit that will bring lots and lots of money to the state of Maine for addiction prevention and addiction treatment. The idea is to try to bring these two addiction interests together and to do something creative that would emphasize the fact that we're not talking about silos here where different people have different interests with respect to the same kind of addictive behavior, but there will be other money, including the money that's in the Fund for a Healthy Maine, to deal with addiction issues. Now, I don't know anything about the lawsuit. I don't know exactly how much money is coming in over a period of time, but I believe it's millions. So yeah, that's one direction that I would certainly advise or recommend that you look at.
So
make sure people know it's an addiction and treat it that way.
Thank you, sir. I think we're getting outside the purview of LD 1523. So are there any other questions of Mr. Delicata? Before you go, sir, you and several others have referred to their testimony. We're finding it's taking a while for things to get through the wormhole and get posted to our website. So if you haven't already submitted that, I invite you and anybody else who has information that you think we should be aware of to make sure that has been submitted.
I have submitted it, and I did get a response that it has been submitted, so I don't know where it is.
Well,
I've also submitted testimony for 1693, which, honestly, I could give you right now because it's pretty much the same except for one thing.
We'll stop there and we'll keep an eye open for your testimony. But this is also a general invitation to folks listening that if they have something else that they want us to know about it, make sure you submit it. It is getting through. It's just taking a while. And our staff will try and chase down yours in particular because you said you submitted it. So
I did. Thank you.
Thank you.
And thank you for the questions.
So I know of nobody else who would like to testify against this bill. If there is such a person, against LD 1523, would you please put up your hand and we can change you from attendee to panelist? I'm not seeing anybody with a hand up. That being the case, we can go to the folks who want to testify who are neither for nor against and ask that we bring in, let's see, I'm having trouble reading the list here.
Jeff Austin is on the way.
Yeah.
And
Yes.
Sarah
Okay.
Calder.
Very good. Thank you. So I see Jeff Austin. Welcome, sir.
Thank you, Senator Claxton, members of the committee. My name is Jeff Austin. I'm here on behalf of the Maine Hospital Association to testify neither for nor against. I have 3 comments. 2 of them are sort of editorial nature, and then 1 is more substantive. The 2 editorial comments are, I understand much of the testimony and concern from proponents is about the use of the fund for medical care. And I'd like to direct your attention to, at least on LD 1523, page 8, line 23, 24. And I think this kind of language appears a few times in the bill where it expressly prohibits the use of funds for medical care. I understand that that's the goal. It does seem a little odd to us that you would set up an advisory committee and then tie its hands and expressly make it illegal to use these funds for medical care. Obviously, the way the board is being set up and the advisory committee is set up, I'm sure most of the people appointed to that board would not be directing funds to medical care, but to tie their hands in statute and say expressly that they may not just seems a little odd to us, a little aggressive. And the second comment is it's particularly aggressive because that was the basis for the underlying lawsuit. We've never argued that the lawsuit requires these funds to be spent on medical care, but it certainly was the underlying issue. So set up an advisory committee and then tie their hands seems a little odd to us. But those are editorial comments. Our real comment that we made 2 years ago, we make again today, is that the money, if you prohibit funds from being used for medical care, you have to backfill those funds. It's around $30 million. So to take that money out of the medical care account in Medicaid without backfilling it creates not only a $30 million hole in the budget, it creates a $90+ million hole in the budget, in the Medicaid budget, when you account for the federal match. I believe the amendment that has been offered changes the bill and in fact appropriates general fund dollars into the medical account and backfills what was removed. That was our testimony 2 years ago. We didn't see it 2 years ago. Created a big concern for us that a nearly $100 million hole was being created in the Medicaid budget. So our comment would be that that sort of needs to remain in the bill, the backfilling of the Medicaid account, or else you've created a $100 million hole. It's such a big,
Yeah.
okay, thank you, Senator. It's such a big deal. I would actually encourage you to send a note to appropriations if one of these bills passes along. There are so many bills on the appropriations table. There's going to be hundreds of them. And while I think they're careful and I think they take their time, we know how the table gets run. It gets run quickly. And we have seen bills where the fiscal note gets just stripped so that they can pass the bill. I would just send a flag that this, you can't just strip the note on this one or else you're creating a $100 million hole in the Medicaid budget. So with that, I'd be happy to take any questions.
Thank you for those observations, comments. I don't see any questions. Next, we'll go to Sarah Calder. Thank you.
Good afternoon, Senator Claxton, Representative Meyer, and members of the committee. I'm Sarah Calder. I'm the Director of Government Affairs for Maine Health, and I'm here to testify neither for nor against. And I submitted testimony for both LD 1523 and 1693. A lot of what is in my written testimony has already been said today, but I would just add that Maine Health strongly supports the overall intent of the 2 bills before you today. We strongly support policies that ensure Mainers have access to high quality, affordable, and equitable healthcare. But despite our support for these initiatives, we have significant concerns about the budget challenges that Mr. Austin just detailed that are created by these two bills, especially for Maine care funding. I would add to what Mr. Delicata said, that the original priorities developed in Maine statute for funding from the Master Settlement Agreement included health insurance expansion for low-income people, and Medicaid funding has been a part of the tobacco settlement funding since the beginning. And I think we can all agree that health coverage for low-income people provides access to comprehensive health care, including preventative services, and is well aligned with the broad goals for these funds. And then I would also note that the dollar amounts to each state in the Master Settlement Agreement itself were based on states' Medicaid costs due to tobacco. So with that said, we agreed that the tobacco prevention and control needs to be the top priority for funding from the settlement. But with 20 years of funding Maine Care through the settlement dollars, we also feel that there are major challenges to funding Maine Care through the strategies set out in this bill. So as Jeff said, should the committee wish to move forward with these bills, we strongly feel that the language must be amended to restore stable and consistent funding for Maine Care. And then I would close by just noting that other states have put their tobacco settlement dollars into external trust funds overseen by an external board, which is what is proposed in these two bills. But in each case, future legislators have defunded them entirely. And so with that said, we believe that the external trust funds put the tobacco settlement dollars at a much higher risk in the long term and strongly oppose this provision of the bill. So again, we're supportive of the overall intent of prioritizing tobacco prevention and control funding with Maine's share of the master settlement agreement. And we really, truly appreciate the work of the advocates to bring these proposals forward. We hope that this committee and the administration can find suitable strategies to accomplish the priorities outlined without disrupting Maine Care funding. And with that, I'm happy to answer any questions that you may have. And thank you for your time.
Thank you for your testimony. Does this generate? Yes, Representative Perry.
Yes, I'm looking for your testimony, Sarah, and I can find it in neither bill. Have you just submitted this, or?
I submitted it this morning, so I suspect that it is lost in the wormhole that Senator Claxton mentioned, but I did submit it and I received the confirmation. So hopefully we'll be there.
Thank you. I will be looking for it.
Are there any other questions? Yes, I noticed that applied to a number of people who offered testimony and referenced their submitted material, which doesn't look to be submitted to us yet on our website.
Yes, I am looking into that delay as well, Senator.
Okay,
because
good.
the disparity is large right now.
Okay, thank you, Karen. Any questions for Sarah? My thought was that you've apparently researched what's happened to trust funds in other states. Do you have access to the information that you could share with us prior to the work session?
Definitely. Yep. Happy to.
Thank you. Sam will be glad to receive that. Won't you, Sam? Okay, I think that's everybody who intended to testify in LD 1523. If that's not the case and you're in the attendee list and you want to put up your hand, we would call you forward, give you a chance to share your opinions. I'm not seeing any hands go up. So this seems like a rather convenient break time for a little bit of lunch. So I would ask the committee if everybody is okay with reconvening at 12:30. It's not a leisurely lunch, but it gives us a chance for a break and get up and move around and maybe see the 40-degree weather out there for a second or two. And then we'll start after lunch at 12:30 with consideration of 1693. Before we leave, are there any questions that you want to direct to Sam in anticipation of the work session? Hands up, Representative Zager.
Yes, very much, Mr. Chair. I'm looking for, I read Attorney General Fry's submitted testimony, and I'd love to get a little bit more clarity on the constitutionality. This has been raised by some testimony. And it seemed like his written testimony seemed to support 2003 Attorney General opinion, and it just kind of is confusing to me. So if we could get some clarity in light of today's testimony, whether the Efficiency Maine Trust demonstrates that such a trust is constitutional, and number two, has this been challenged in the courts, or is it simply been done and not yet fully challenged? I'm literally unclear on the constitutional issues. Thank you so much, Sam.
Thank you. And we'll get a chance to get some more background, and certainly we could invite the Attorney General to our work session to share his interpretation if that will be helpful. So we'll leave that open as an option. Okay, I don't see any other things to go to Sam. Thank you for everybody who brought testimony on 1523, important issue. We will reconvene at 12:30 and see everybody then. So good afternoon, everyone. I think we're finishing up our lunches as we gather. We concluded this morning's hearing on 1523. It's still nominally in the morning as we begin consideration of 1693 on using a legislative time clock. So at this point, we'll hear from somebody to present 1693. And then I want to make a point for the folks who at this point are listening in. I'm looking particularly for Senator, where is he? Well, Rachel Talbot Ross is here, so if she's available, then I would move her into the room if I had host privileges. I don't see, my understanding was that somebody else was going to present, but if, okay. That just became Senator Ben Chipman standing in for Representative Talbot Ross. Welcome. Good afternoon, Senator.
Good afternoon, Senator Claxton, Representative Meyer, distinguished members of the Joint Standing Committee on Health and Human Services. You're correct. I am Senator Ben Chipman. I represent Senate District 27, which is part of the city of Portland, and I'm here as a proud co-sponsor of this important bill. I'm here today to present testimony on behalf of Rachel Talbot Ross, State Representative for District 40. I'm here to introduce LD 1693, an act to advance health equity, improve the well-being of all Maine people, and establish a health trust. Representative Talbot Ross asks that you please accept her heartfelt apologies that she cannot be here today in person due to a family emergency that unfortunately she has to deal with. I want to start by reiterating my thanks to the committee for all the time and effort you've put into doing the virtual important work of public health policy at this most critical moment. The relentless impacts of the COVID pandemic, which have been exacerbated by pre-existing weaknesses in the systems and structures that are intended to support good health and well-being, are putting tremendous stress on our communities, our economy, and our humanity. I'm honored to be working with all of you to pursue tangible actions toward measurable progress in tackling the most egregious problems that perpetuate health disparities and generational poverty in Maine. Together, I hope we can build a new and integrated framework for good health through an equity lens, prioritizing our shared resources to create new opportunities for all people in Maine. When I talk about health equity, I'm talking about making life better for every person in every town and every corner of Maine. I'm so pleased to be talking with you today about LD 1693, a bill which I believe offers us a unique opportunity to recognize and rebuild the underpinnings of Maine's public health framework that have directly and indirectly contributed to health disparities in our communities. In recent years, threats to our health and productivity have been unrelenting. In addition to COVID, serious trends, including youth vaping and nicotine addiction, opioid misuse, and other substance use disorders, trauma and toxic stress, diabetes, hunger, and homelessness. Maine children are more at risk for a lifetime of poor health, while our employers struggle daily to maintain healthy workforce. At the center of LD 1693 is tobacco, and appropriately so, because tobacco use is at the root of so many health disparities. The tobacco industry has a long history of creating and feeding disparities through the targeting of youth and young adults in marginalized communities. This ruthless industry uses predatory marketing campaigns, cheaper prices, product promotions, and countless other methods to create not just cultures of tobacco use, but generation after generation of young people addicted to nicotine. The subsequent health impacts are devastating to Maine families, communities, and our economy. But LD 1693 goes beyond tobacco to build a more comprehensive policy framework for achieving health equity. There are 5 major components to LD 1693. The first major component of this bill restructures and secures the tobacco settlement. This bill resolves a looming $20 million per year structural deficit in the Fund for a Healthy Maine and secures the tobacco settlement for Maine kids and communities by stabilizing medical care and child care in the general fund. It establishes the Trust for a Healthy Maine. This new public health trust will ensure that tobacco settlement monies are used as intended to reduce tobacco addiction and improve the health of Maine youth and young adults. To this end, the trust will be required to fully fund a best practice tobacco program, make annual investments in the systems and structures that will advance health equity, and align the remaining allocations with Maine's state health plan. This is the same policy and language you are considering in the bill you heard earlier, LD 1523, sponsored by Representative Millette, as is the statutory language required to make the revenue neutral financing restructuring, which is included in my prepared amendment. Second, this bill builds a best practice policy framework for tobacco prevention and treatment. Specifically, LD 1693 ensures and automates full funding for Maine's tobacco prevention and treatment program at a level recommended by the U.S. Centers for Disease Control through the creation of the Trust for a Healthy Maine. LD 1693 ends the sale of all flavored tobacco products that the tobacco industry uses so effectively to lure and hook our kids. And LD 1693 reduces nicotine addiction among youth who are particularly sensitive to price by significantly increasing Maine's cigarette excise tax by $2 per pack. Third, this bill begins to rebuild Maine's obesity program. LD 1693 responds to concerning trends of obesity and the medical conditions associated with obesity by funding an obesity prevention programming and one staff person at Maine CDC. The bill aligns Maine's early care and K-12 nutrition and physical activity standards with nutritional standards. And with my proposed amendment, also establishes an obesity advisory council to support the Maine CDC obesity prevention program. Fourth, LD 1693 adds important definitions to statute. Naming the components of an equity-centered system is the first step in building and sustaining that system. LD 1693 adds definitions for a community health worker, community resilience, social detriments of health, social group, structural inequity, and systemic racism. Fifth, this bill builds the scaffolding for achieving health equity in Maine. LD 1693 establishes the Office of Population Health Equity and statute. It allocates funds for Maine's public health district improvement plans, and through the creation of the Trust for a Healthy Maine, it creates annual funding stream for health equity and health improvement. It would be difficult to overstate the importance of this final piece of the puzzle. The new Trust for a Healthy Maine would guarantee an annual investment in the systems and community-based infrastructure necessary to achieve health equity, no matter who you are or where you live in Maine, including data collection, planning, community-led partnerships, workforce development, training, and technical assistance. Communities need the capacity to act, the relationships to be successful, and they need to be empowered to determine their own futures. This bill tackles the essential restructuring and modernizing of the tobacco settlement and creates a sustainable investment in this foundational community capacity. I want to call your attention to the work of the Permanent Commission on Status of Racial, Indigenous, and Tribal Populations. In the Commission's recommendations to the Maine Legislature dated September 2020, future legislators are advised to, 1, make direct ongoing investments into communities, both to build infrastructure and to allow self-determination. 2, allocate resources and establish systems necessary to address health disparities. 3, target the opioid crisis to address strain on tribal communities. 4, takes a bolder approach to the criminal justice reforms. And 5, institutionalizes a process to view legislation through a racial equity lens. LD 1691, LD 1961, which is a bill left unfinished in the 129th legislature, laid out the first effort at resolving the structural deficit in the Fund for a Healthy Maine. LD 1961 established a tobacco settlement trust, which we considered carefully and improved significantly before COVID upended our work. LD 1961 was specifically highlighted in the Permanent Commission's 2020 report for its alignment with recommendations 1 and 2. The Commission wrote, quote, as established, LD 1961 would provide a stable and ongoing funding stream to reduce structural racism and structural inequity and improve public health systems and infrastructure. The tobacco settlement is a particularly appropriate funding source given the tobacco industry's historic and ongoing targeting of African Americans in their product marketing campaigns, particularly for menthol flavored products, end quote. Passing this bill, LD 1693, will restructure systems, strengthen programs, and ensure sustained investments to advance health equity and improve the well-being of all people of Maine. I ask for your vote in support of this bill, a comprehensive transformational restructuring of our public health policies. Thank you for your time today and for your dedication to the service of the people of Maine. And Representative Ross will be available at the work session and is happy to answer any questions you may have in the meantime. And I'm happy to try to answer any questions you may have, although I've not worked on this issue for over 4 years when I served on this committee, so I may be a little bit rusty, but I'm happy to field any questions you might have. And lastly, just wanted to close by highlighting what you may have heard earlier this week or may not have heard of what we did in the city of Portland, which I represent here in the state Senate, which was our city council passed with a unanimous vote 9-0 to ban the sale of flavored tobaccos here in the city, and joining the city of Bangor, who did that previously. So I urge you to act on this bill and take the right steps forward to take action on this issue right away. Thank you.
Thank you, Senator Chapman, for introducing this bill. Were you also responsible, or were you invited to submit the amendment, or are we?
The amendment, I believe, was submitted together with the testimony. If
It was.
Representative Talbot Ross, it should be there.
Okay.
Yep.
All right. Thank you. Are there any questions of Senator Chapman? I'm not seeing any. So thank you for being here and thank you for introducing that.
Great, thank you.
I think next we'll go to a substantial list of people who want to testify for. Before we go to a substantial list of people who want to testify against, I will point out that at the last I looked, there were close to 50 people who wanted to testify this afternoon. It's come down a little bit, and I ask that you keep your testimony and support succinct. If you can, I'll leave it at that. And we do have a timekeeper, and she's vicious. So thank you, Senator Moore, for covering the clock for us. So let's start with, I didn't mean that. Let's start with Allison Dragg.
Thank you so much, Senator Claxton, Representative Meyer, and members of the Health and Human Service Committee. My name is Allison Perrin-Dragg, and I'm the Government Relations Director for the American Heart Association. Our mission is to be a relentless force for a world of longer, healthier lives. We are supportive of both LD 1523 and LD 1693, and I'll focus my testimony on LD 1693. Eliminating racial and ethnic health disparities is one of the most important steps to ensure that everyone, no matter their zip code, has an opportunity to live a longer, healthier life. LD 1693 presents an important opportunity to recognize and rebuild Maine's public health framework that have directly and indirectly contributed to health disparities in communities across the state. The major components of the bill include tobacco, obesity, and equity policies. The use of tobacco products remain the nation's #1 cause of preventable death, and in Maine, it is no different. Our youth are at most risk because of access to flavored tobacco products, low price, and not enough funding for prevention and treatment. More than 27,000 kids will die prematurely from smoking if we do not act to protect them. We must do everything in our power to keep our communities healthy and safe. We know the problem caused by tobacco, and we know that a comprehensive approach to tobacco control aimed at protecting our kids from all tobacco products, funding a treatment and prevention program, eliminating all flavors, and increasing the price by raising a tax are all critical parts of the solution. These approaches will save lives and money. All children, no matter where they live or go for childcare or school, deserve healthy food and time for active play. Parents support clear and consistent standards in early child care and education, settings for food and beverages, active play, and screen time. And providers want to offer an environment that nurtures healthy children. Early care and education standards support the need of children's parents and providers. Standards will ensure that all kids are being served more fruit and vegetables, drinking water or milk instead of sugary drinks, engaging in active play for at least 1 hour a day, and keeping the time they spend in front of a TV or a computer or tablet limited. Lastly, health equity is achieved when every person can attain his or her full health potential, and no person is disadvantaged from achieving this potential because of social position or other socially determined circumstances. This bill would look to address social determinants of health and the aspects of the environment in which people are born, grew up, live, work, and age, as well as the systems put in place to deal with illness, and would ensure that evidence-based strategies will be used to promote equitable, social, economic, and environmental conditions to achieve optimal health, mental health, and well-being for all. I'd ask that you vote ought to pass on LD 1693 and would be pleased to answer any questions you may have. Thank you.
Thank you for being so succinct. We appreciate that. Well done. In the old days, if we'd been in committee 2 years ago, you would have gotten the gold star.
What I strive for, always.
There you go. All right. I don't see any questions. So again, thank you for being here. Thank you for your testimony. Let's hear from Heather Drake.
Good afternoon. I hope to follow with that gold star as well. So good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Heather Drake. I'm a resident of Cape Elizabeth and the Membership and Engagement Director of the Maine Public Health Association. I'm here in support of LD 1693, an act to advance health equity, improve the well-being of all Maine people, and create a health trust. As you know, LD 1693 has many components. It assures an annual investment in systems and infrastructure to improve health equity through the Trust for a Healthy Maine. It establishes baseline funding for the public health district's health improvement plans and establishes in statute an Office of Population Health Equity, including funding for the office's director and data collection and reporting. I'll go into a little bit more detail about these provisions. LD 1693 adds the following definitions to state statute: community health worker, community resilience, social determinants of health, social group, structural inequity, and systemic racism. Adding these definitions provides clarity about what is intended in the legislation, and it advances efforts to improve health equity and address systems of inequity by naming them and creating context for investment. We believe these definitions align the legislation with the realities of what is needed to modernize and improve public health in Maine. LD 1693 also provides funding for public health districts' public health improvement plans. The DFIPs identify each district's public health priorities and associated multi-year plan of objectives, strategies, and outcomes to address those priorities. The DFIP also informs the state health plan and meets public health accreditation and national public health standards by using a community-based multi-sector partnership model to improve public health. Currently, these plans are not funded, and we believe establishing baseline funding in the budget is important for ongoing support for public health district efforts to address health priorities. Last, LD 1693 provides funding for the Office of Population Health Equity. The OPHE is located in Maine CDC and responsible for promoting population health equity by addressing root causes of health disparities through data-informed interventions, community partnerships, and community-led solutions. The work of this office aligns well with the health equity funding cascade within the Trust for a Healthy Maine, in particular, the focus on data and community partnerships. I respectfully request you to vote LD 1693 ought to pass. I thank you for your time and consideration.
Thank you for your testimony. Are there any questions? Before we proceed to the next person offering testimony, I will point out to people in the attendee list that people are coming in basically by alphabetically by first name. So you've not been forgotten. We'll get to everybody, I promise. Let's go to Joanne Mason. Welcome.
Thank you. Good morning, Senator Claxton, Representative Meyer, and the esteemed members of the Health and Human Services Committee. I am Joanne Mason from Reedfield in Kennebec County. I'm here to speak in support of LD 1693. The Antifreeze Safety Act of 2005 mandated that all antifreeze products have deutonium benzenate added to them. Why? Because before the law was enacted, antifreeze tasted good. Pets and children alike would drink it, and it was deadly. It was even used by some criminals to poison because it was hard to detect due to the taste. So we as a society had a simple solution to this problem, and we added something that made it taste bad. So why did I talk about antifreeze? Because theoretically, tobacco is more dangerous than antifreeze because more people die from it. But instead of trying to stop our children from consuming it in any form, the tobacco companies have made it more enticing. 11 years ago, my mother died of small cell lung cancer after 3 different battles with cancer. Her death was 100% due to tobacco use. After having her quit for 15 years, her addiction resurfaced, then she promptly died from it. I am a former tobacco user, which started as a very young child. I have been a tobacco-free for 27 years now, but let this sit with you for a moment. I was 8 years old when I smoked my first cigarette. It was 20 years before I was able to quit. We Mainers need to stop hearing about how people have the right to choose their own flavors of poison, and we need to regulate it and make it more enticing for anyone, especially children. Nicotine addicts, adults, will find a way to get what they need to manage their addiction. It may be nicotine patches, it may be tablets or gum, it may be yucky tasting tobacco. Those are all choices they need. That's all they need for choices. Let's leave the bubblegum flavors to the bubblegum and get this done. Thank you. I'm here if anybody has any questions.
Thank you. I don't see any questions, so thank you again for being here. Now we can hear from Joe Anderson.
Distinguished senators and representatives, my name is Joe Anderson. I'm a resident of Portland, a pediatrician in Lewiston, and I sit on the board of the Maine chapter of the American Academy of Pediatrics. I'm testifying today in strong support of LD 1693, which tackles childhood nutrition and obesity, addresses health disparities, and strengthens public health infrastructure. I'd like to specifically highlight this bill's goals to reduce tobacco use in youth by ending the sale of all flavored tobacco products and by increasing the tax on cigarettes. In my work as a hospital-based pediatrician, I see firsthand the detrimental effects of tobacco use on children. Mothers who are unable to overcome their tobacco addiction during their pregnancy often deliver babies prematurely or with low birth weights. These infants often have challenges establishing feeding or maintaining their temperature and blood sugar levels, which can lead to extended hospital stays in our special care nursery. Young infants who live with mothers in the home or who live with smokers in the home are more likely to develop a viral respiratory illness called bronchiolitis, often requiring admission to the hospital, where we support their breathing and help keep them hydrated with IV fluids or tube feedings. As these children get older, they are more likely to develop ear and respiratory infections, and many develop asthma, sometimes requiring visits to the hospital and causing unplanned absences from school. For a pediatrician, I also have a unique perspective as I was a regular smoker for over 15 years. My friends and I began trying new flavored cigarettes with tempting names like Twist and Mandarin Mint, and would share a pack while going out on the weekend. By the time I left for college, I was a pack-a-day smoker and spent nearly a decade trying to quit. RJ Reynolds agreed to stop selling these flavored cigarettes in 2006. That was also the first year that electronic cigarettes were introduced in the US. The tobacco industry quickly pivoted and found a new vehicle for appealing flavors that continue to entice teens to use their highly addictive products. You'll likely hear testimony today from local businesses understandably concerned about their profits, quoting research and statistics provided by the tobacco industry and their lobbyists, stating that flavor bans don't work. But let me state clearly, the reason these products exist are to entice young people to become lifelong, addicted consumers of tobacco products. Maine has the second lowest cigarette tax rate in New England and has more smokers than any other New England state. The opposition to increasing the cigarette tax from the business community tells you everything you need to know, that raising taxes on cigarettes is one of the most effective methods to reduce smoking rates overall, and especially among teens. I urge you to prioritize the health of our children over revenue. Thank you, and I'd be happy to answer any of your questions.
Thank you, Dr. Anderson. Are there any questions of the doctor? I'm not seeing any. So again, thank you for being here. And we can go now to Catherine Richardson. We don't consistently go in alphabetical order. It depends upon when people are admitted to the panelist.
She was here and now she's gone, Senator.
Well,
I'll see if I can get her back, but she was
see if you can
here.
Get her back. Let's move on to Julio.
I'm here.
Okay.
Yay.
It's just my voice. I don't have a picture. Do you see me?
No.
Have her hand raised.
Yes, I do. Oh, here. I'm sorry.
At the other end of the row that you use to raise your hand, there should be a stop video. There we go.
I am. Sorry about that. Good afternoon, Senator Claxton, Representative Meyer, and the esteemed members of the Health and Human Services Committee. My name is Catherine Richardson. I am a resident of Mount Desert, Maine, a retired registered nurse, and I might add a concerned grandmother. LD 1693 has the potential to fulfill in part our state's duty to protect the health of our citizens. I would like to speak to Section D of that bill, that would prohibit the sale and distribution of flavored tobacco products. Put simply, these products contain a potent amount of highly addictive nicotine that is particularly dangerous to the developing brains of young people. Cleverly marketed with enticing names like gummy bear, lemon fizz, and fruit pebbles, they represent a clear and present danger to our kids and should be prohibited. The point is, big tobacco was losing money because more and more people of all ages were not smoking anymore. But they found a new way to entice potential smokers. Out came the vast array of flavored tobacco products with yummy names. Products that are primarily used by young people. To make matters worse, kids who use e-cigarettes are 4 times more likely to make the switch to traditional cigarettes than their non-vaping peers. So you see, the tobacco industry's devious plan to lure and hook our kids into lifetimes of addiction is working. I am a nurse who has cared for many individuals who were dying from tobacco-related illnesses and counseled those who struggled with addictions that dominated their lives. And I'm here to say enough is enough. It is time for government, good government, to once again do its part in mitigating the needless, preventable addictions and suffering that frontline healthcare givers see day after day, year after year. We can't do it all in the trenches. Every moment we delay prohibiting flavored tobacco products, our kids are easy prey to the traps being set for them. I am asking you to choose good governance and not turn a blind eye to a clear and present danger to our kids. Thank you for this opportunity to speak.
Thank you for your testimony. I don't see any questions, so let's hear from Julia Panapinto.
Hello, good afternoon, Senator Claxton, Representative Meyer, and the esteemed members of the Committee on Health and Human Services. My name is Julia Panapinto, and I'm a Portland resident and a graduate of Bates College. And I'm here to share the story of a good friend of mine. Her name is Ruby Lightborn. We played volleyball together at Bates, and she was unable to get on today and testify. And so I promised her that I would share her story. When Ruby was a junior in high school, she frequently, judged all of her friends that used combustible, unflavored cigarettes. She thought they were gross and knew well enough from her health classes that they were bad for you. However, by the time Ruby was a senior in high school in 2017, flavors were all over the market and they were clearly targeted at kids around her age. She bought a creme brulee Juul herself as a 17-year-old and has distinct memories of texting her high school volleyball teammates to meet in the bathroom and vape. She used that Juul for about 2 weeks, but it really hurt her throat. She ended up getting mono, and so she threw it out. Unfortunately, when she arrived at Bates for her freshman year of college, Juuling was still very much a thing. So she bought a cucumber and a mango Juul at a convenience store and has yet to stop smoking since. She always knew there was nicotine, and she thought that flavors were better because they lacked the tobacco scent and taste. But when mango left the shelves, she switched again to mint and menthol, even after trying to quit many times. Every time she came back because there were always more flavors to choose from. Ruby also recently came out of the closet, and she now proudly surrounds herself with many gay women like myself and is incredibly proud of her identity. However, she strongly believes that one of the hardest reasons to quit is that smoking has become such a cool factor for many, many gay women and gay folks in general. And I share all that just to highlight that despite the good tasting flavors, the lack of smell, the accessibility, and the cool factor in the gay community, if it wasn't for mint and menthol flavors, she would have quit when those mango Juul flavors were taken away. And so Ruby's current preferences cycle around whichever brand is able to get their newest flavors on the shelves. She currently rotates between Puff, Peach Ice,
30
Supreme
seconds, Julia.
Peach Freeze, and Menthol Jewels. And she wants to quit, but the flavors keep her hooked. So I urge you all to move this bill forward and to end the sale of flavored tobacco products, because too many kids like Ruby are getting hooked because of the flavors. And thank you.
Thank you for bringing her story and your testimony. Don't see any questions, so let's hear from Kathy Wilson. Good afternoon.
Hi there, how are you? My name is Kathy Wilson, and I happen to be an at-large counselor in Brunswick. And just the other night, we are the third. I brought forth a to ban flavored tobacco in Brunswick, and I hope we will be the third city and town in the state of Maine to do it before the state gets to it. I'm a former smoker. I actually started smoking before I was 13. By the time I was 13, I was smoking fairly regularly. I do remember the first cigarette. It was a Lucky Strike, and I hated it. So I switched to Salem or Cool or whatever menthol was going at the time and progressed on. I smoked for another 20 or so years. The last 2 or 3 years I smoked, I was smoking between 2.5 and 3 packs a day, getting up in the middle of the night. At 2 o'clock, I couldn't get through the night without the nicotine. I did quit. It was the single hardest thing I've ever done in my life. I was a miserable bee for quite a long time. So I know what smoking does to you. And I also have a lot of friends my age. Did I say I'm 76? I have a lot of friends my age that I've known all my life. And many of them are home on oxygen or something like that because of smoking. Many have died already. To move on to the vapes, I have grandkids in my family, not mine, but that started vaping when they were like 13 or 12 or 13, because they believed that it was not the same as tobacco. They believed that it was safer, which was what was believed when vaping was brought forward and all these flavored tobaccos. I even thought they'd probably be all right back then. I've since learned different. Several of these grandkids are now hooked. One has another disease going on, type A diabetes, and she can't quit. And she just knows that by the time she's 50, she's going to be able to die from one or the other of them. I've talked with, obviously, where I brought this forth in Brunswick, I've talked with nurses and other health people, and I've realized that there's so many things in the vaping. Aside from the nicotine, there's an oil that I've been told by one nurse that is actually more dangerous in the lungs than the nicotine, or the combination of both is crazy.
30 seconds, Kathy.
Thank you. So I am obviously in favor of banning the flavored tobaccos and the obesity. Obviously, I have a problem with that too. So and that's been my whole life. I'd like to see that go on. I don't know. I don't have a whole lot more to say, except for I know it's dangerous. I know the kids vape because it tastes like cotton candy or other kinds of things like that. And the one other thing I would throw in there is the vaping often leads to cigarettes. I'm a dog person, and I've raised and bred and showed dogs all my life. Smoking in the house will kill your dog too. So that's a little bit off from the vaping, but please, I beg you to support this and ban the vaping in the state of Maine. The flavored tobaccos, not all vaping, flavored tobaccos. That's where it starts. Thank you. Glad to answer any questions.
Thank you for your testimony and for sharing your story. Not seeing any questions, we can go to Madeline DeFossis.
Thank you so much. Good afternoon, Senator Clayton, Representative Meyer, and the esteemed members of the Health and Human Services Committee. My name is Madeline DeFossis. I am a resident of Portland, Maine, as well as a public health associate with the U.S. Public Interest Research Group. We are a nonpartisan organization working on ending the sale of flavored tobacco products in the state. However, today I'm speaking to you as a concerned Mainer in favor of LD 1693 and on Section D, which prohibits the sale and distribution of flavored tobacco products. In 2017, I graduated from George Stevens Academy in Blue Hill, Maine, right as flavored e-cigarettes were just starting to become immensely popular among high school students. When I left Maine to attend Mount Holyoke College, a women's college in Western Massachusetts, I was blown away by the level of tobacco use on my campus. Many of my peers and friends had become hooked on flavored e-cigarettes in high school and continued to use these products as college students. I still remember sitting in a lecture hall, watching as a student just a few rows in front of me try to discreetly use a flavored e-cigarette, and this was during just an hour-long class. During my first couple of months on campus, I watched as many of my peers and many of my friends turned from flavored e-cigarettes to traditional cigarettes and other forms of tobacco. Watching my intelligent and capable classmates and friends become addicted to tobacco to the point where they couldn't sit through an hour-long class period without needing to vape was a disturbing experience, to say the least. By the end of my first semester, I had created a petition of support for a tobacco-free campus, and by the spring, I left behind, and by the spring of last year when I graduated, I am proud to say that I left behind a 100% tobacco-free campus. And while I think this is a very important part of the solution, I know this only impacts that college campus and those adult students who had already been hooked on tobacco products since middle school and high school. We need broader policies that prevent high school and middle school students from becoming addicted to tobacco in the first place. Tobacco use and addiction among my friends and peers is what motivated me to enter the public health sphere. In 2021, the National Youth Tobacco Survey showed that 85% of youth e-cigarette users reported using a flavored product, a number that reflects what I saw from my time in high school as well as in college. Given the widespread availability and use of flavored tobacco products, it is absolutely necessary that we take action on the state level to protect the health of Maine kids. LD 1693 is an opportunity to ensure that Maine's youth have bright and healthy futures free from tobacco addiction. And
30 seconds, Madeline.
Thank you so much. I urge you to support LD 1693 to ensure that Maine's youth have bright and healthy futures ahead. Thank you so much for your time and thoughtful consideration.
Thank you for your testimony, and I'm sorry I mispronounced your last name, Madeline DeFosse.
No worries.
Next, we'll go to Patricia Clark.
Good afternoon, Honorable Senators Claxton and Representative Meyer and members of the Joint Standing Committee on Health and Human Services. Thank you for your attention to my testimony. My name is Patricia Clark. I am testifying in favor of LD 1693. I would like to focus primarily on the element of this bill that would end the sales of flavored tobacco products in Maine. I'm here to offer my in excess of 35 years as an educator, first in elementary school and then now at the college level with a focus on early childhood education. I have been working with children and families over the years and now teach students of all ages, 16 through 70. For the past 10 years, I have supervised interns, field placements, and student teachers in schools at all levels. When I was teaching elementary school, I witnessed how addiction to tobacco and nicotine products made families struggle to pay for that use in more ways than one. The costs were great of this addiction to tobacco, especially for impoverished families. The needs of children were no longer more important than the next smoke, as Dr. Anderson said. We know now that secondhand smoke is nearly as bad, if not worse, than first, and are learning that secondhand vape is also bad for children. I saw children constantly absent from school because of upper respiratory and asthma problems, and even their pets were sick, as the one lady mentioned. According to the Journal of the American Medical Association, 4 out of 5 children who have used tobacco began with a flavored product. The most dangerous flavored tobacco product is menthol. I'm sorry, my dog. Cigarettes. And the tobacco industry has a long and deadly history of targeting youngsters with flavored products and subtle advertising. Maine is experiencing what Pediatric Journal reports as a public health crisis, an explosion of e-cigarette or vaping with teens. One Juul pot has as much nicotine as a pack of 20 cigarettes. Since young are more susceptible to tobacco addiction, we must stop this extreme escalation of vaping. One way to do this is to halt the sale of flavored tobacco products in Maine. The health of future generations is at stake. Please vote for LD 1693. We need a good plan for prevention. We need racial and ethnic and other socially related health disparities to be addressed. We need funding for a
30
planful
seconds,
approach
Patricia.
to the health of Maine's children, and we need to end the sale of flavored tobaccos. I included the resources with my testimony in case you wanted to go through. There's a page of resources. Thank you very much
for your testimony. I'm not seeing any questions, so let's hear from Renee Page.
Hello. Senator Claxton, Representative Meyer, and members of the Joint Standing Committee on Health and Human Services. I'm here in support of LD 1693. My name is Renee Page. I live in Farmingdale, and I'm Executive Director of Healthy Communities of the Capital Area, located in Gardner, serving primarily Southern Kennebec County. Our focus is primary prevention. We are a trusted local partner collaborating with other community partners on a variety of public health issues. In primary prevention, we often say we work to make the healthy choice the easy choice, and do so by identifying and eliminating root causes of disease, poor health, and overall poor quality of life. My written testimony outlines 4 points I'd like to make, and I encourage you to read the full text, but in the interest of brevity, I'll focus on 2. First, Maine needs a robust state health plan and process for the long term, as well as allocations for prevention. This will allow for better health outcomes, cost savings, and efficiencies, because the way prevention is addressed now without a long-term plan and the funding to support it is at the whim of the state biennial budget-making process that feels honestly more like public health Hunger Games versus a sound science-based strategy. Second, LD 1693 requires a dedicated obesity prevention position to be reinstated at Maine CDC. Maine continues to be the most obese state in the Northeast, and poor diet and other obesity-causing factors like inadequate sleep, stress, exposure to tobacco as a child, endocrine disruption, low income, and other factors all contribute to this complex disease that plays a major role in almost every form of chronic disease. We even know that individuals who are overweight or obese are at a much greater risk for poor outcomes from COVID. Statewide in 2019, 42% of third graders were overweight or obese, 42%. And that number was pre-COVID. Right now, there is no robust obesity prevention plan or staffing for the state. We used to have community-based primary prevention happening in all communities across the state, but now it may or may not be happening in a town near you as the result of current funding formula. Oh, right on cue. Bella, I apologize. Sleeping quietly since 10 this morning, I'll add. Apologies.
30 more seconds, Renee.
Got it. This current iteration of Maine Prevention Services, formerly the Healthy Maine Partnership Initiative, both supported by the Fund for Healthy Maine, is in a 9-month contract extension that ends June 30th, with no indication of what the next round of primary prevention funding will look like or address. This leaves a public health workforce across the state feeling vulnerable and uninformed as we wonder if and what the plan is for ongoing prevention work. Establishing a trust and a permanent obesity prevention position at Maine CDC is a way to get back on track, learn from successes and failures over the past 20 years, and work together toward a healthier Maine. Thank you for considering this testimony. There are many reasons to support LD 1693. It's a big bill, and I'm happy to make myself available for a work session. I encourage you to read my full testimony where I make additional points from the perspective of a community-based prevention. So thank you. And I apologize for my animal.
Thank you, and thank you for bringing your dog. We've had parakeets and all kinds of things.
I have my
Cats.
fish as well. But
They're a
again,
little-
thank you.
They're a little better behaved than the dog. Let's hear from Rebecca Bullis. Welcome back, Becca.
Yeah, good. Thank you. It is nice to see everybody again. Good afternoon, Senator Claxton, Representative Meyer, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Becca Bolus, and I'm Executive Director of Maine Public Health Association. I live in South Portland, and I am here in support of LD 1693. As you well know, there are many provisions in this bill. You heard from me earlier this morning about our strong support for the Trust for a Healthy Maine. In our testimony for 1693, I linked to other testimony that we've already provided on LD 1550 about flavored tobacco products and 1423 about the cigarette excise tax. So I will not go into that testimony now. Instead, I'm going to kind of build off of what Renee was just talking about and focus on the obesity prevention provisions in the bill. As you heard, this bill funds a Maine CDC obesity care coordinator and provides funding for obesity prevention programming. It aligns early care and K through 12 nutrition and physical activity standards with national ones and establishes an obesity advisory council to support Maine CDC's obesity prevention programming. My PhD is in food policy and applied nutrition with a specific focus on obesity prevention and nutrition intervention. So I'm particularly excited about these provisions in the bill. We know that obesity is a complex, chronic, and relapsing disease in which excess body fat leads to physiological impairments. The disease of obesity increases the risk of developing other chronic diseases and is associated with early mortality and reduced quality of life. It poses a serious threat to public health and productivity in Maine, as we've seen our obesity rates tripling among adults, and it costs millions of dollars in medical costs alone in Maine every year. Given these considerations, we're supportive of the funding for the Maine CDC staff position. We believe that at least one full-time staff person in the state health department is needed. Currently, right now, Maine's obesity prevention programming is primarily done through Maine Prevention Services contract with Let's Go. We're excited about the staff position because we feel like it would be well poised to work with the new Office of Population Health Equity and the Permanent Commission on the Status of Racial, Indigenous, and Tribal Populations, among other offices and commissions, to identify populations that are most impacted by obesity and engage those stakeholders to identify and develop strategies to address these health inequities and reduce the prevalence of obesity. We strongly support the strengthening of early care and K through 12 physical activity and nutrition standards. The provisions in this section are well aligned with the Bipartisan Policy Center's Food and Nutrition Security Task Force's recommendations, which were just published at the end of January. And in my testimony, I include information about the relationship between physical activity and healthful diets for children's physical and mental health, their academic achievement. Thank you. Their academic achievement and behavior, and their mental health. We want to make sure that all children in all parts of the state have access to nutritious foods and sufficient time for active play. Lastly, we're supportive of the Obesity Advisory Council. This proposed council was modeled after the Tobacco Prevention and Control Advisory Council, which serves as an advisory body to the state's tobacco prevention and control program. Given the complexities associated with weight status and the associated approaches to interventions and the underdeveloped state-led program, we believe such an advisory body would be critical for strengthening the state's program quickly and effectively. Again, I do realize there are many parts to this legislation. I'm happy to answer questions now or prepare additional materials for the work session in advance. I do want to thank you again for listening to our testimony and for all the testimony today on both bills. I know it's a long day, and we are grateful for that. And with that, I will end my testimony. So thank you.
Thank you for being here and bringing that perspective. I was just looking to see that we have your submission, and you, according to this, you turned it in today. Is that correct?
I have not turned it in yet. I will be turning it in. I've turned it in for 1523.
Okay, well, it ended up in the 1693.
Oh, okay. Well, we'll have to fix that.
Yeah, we're just trying to figure out why some things are showing up and others aren't. A number of testimonies have appeared from today in the list of attachments, but we'll see that. As I understand it, thank you. As I understand it, there's nobody else to testify in support of this bill. If that's not correct, could you please raise your hand if you're in the attendee list? And we'll get you in here so you can share your testimony? I'm not seeing any hands go up, so that will conclude the in favor of portion of the testimonies. And now we'll hear about folks who are against this bill. And again, we'll try and do them in alphabetical order in which you're signed up, but I can't promise that will happen. Gotta be flexible. If, let's see, are you moving people in?
I am indeed.
Let me go back to Owen Casas first. His name just popped up, and we'll see if he wants to testify in support. Good morning, Owen. Were you planning on testifying in support of LD 1693? Owen, if you're there, if you want to unmute, thank you.
Yes,
you
no, not in support. And I thought we were doing opposition, Senator.
We are alphabetically by first name, so we're going to kick you out of the panelists, and we'll give you a chance later on in alphabetical by first name, okay?
Thank you.
Thank you. So that brings us to Amanda Klingler, thank you. Go ahead.
Thank you. Senator Claxton, Representative Meyer, and members of the committee, thank you for the opportunity to discuss LD 1693 today. My name is Amanda Klingler. I'm a partner at King & Spalding in the firm's FDA group. I'm here today to provide comments on LD 1693 on behalf of my client, Reynolds American, and its affiliated companies. We share the state's interest in tobacco harm reduction, and we share the state's interest in keeping tobacco products out of the hands of youth. Rather than through the current categorical ban of flavored tobacco products, these interests, however, can be better addressed by incorporating FDA's regulatory oversight of tobacco products into the bill. We urge this committee to include an exemption from the flavor ban for products for which FDA has determined the marketing is appropriate. This exemption makes sense from a public health perspective. For example, let's take FDA's review of PMTAs, or pre-market tobacco product applications, for INS, or electronic nicotine delivery systems, or vapor products as we've been referring to them. As the state is aware, I believe from past hearings, FDA's process for reviewing PMTAs and granting marketing orders for which orders that permit the marketing of the product, requires manufacturers to go through a strict, scientifically evidence-based process. PMTA submissions are voluminous and require submissions of large amounts of scientific data. In weighing the evidence submitted and ultimately issuing a marketing order, FDA must find that a PMTA provides scientific evidence that demonstrates that the marketing of the product is appropriate for the protection of public health. In other words, any decision by FDA to grant a marketing order for a PMTA means that the federal government must have decided, based on its technical and scientific expertise, that the marketing of the product is appropriate for the protection of public health. Conversely, FDA must deny a PMTA if it finds the marketing of any product is not appropriate for the protection of public health. So importantly, exempting products for which FDA has issued a marketing order from this proposed flavor ban will not result in a loophole for products. It will only allow those products for which FDA, after its review of the evidence submitted, has determined marketing is appropriate. And again, as I believe the state is aware from past testimony, since FDA acted to remove flavored INS products from the market in 2020, those and new flavored products can only enter the US market if and only if FDA issues a marketing granted order on the PMTA. Since fiscal year 2020, FDA has accepted over 6.5 million PMTAs by its September 20th deadline. It has issued only 3 marketing granted orders for INS products. Conversely, FDA has issued over 1.2 million denials for these end products alone. And FDA has issued over 5 million refused to file, so they're not even looking at those applications. Products that are still under review are not allowed to be marketed flavored products.
30 seconds, Amanda.
Thank you. Products that are still under FDA review, flavored products, are not allowed to be marketed until they get that marketing granted order. Congress entrusted FDA with making judgments on tobacco products applications like PMTAs for ENDS products because of FDA's expertise in evaluating the scientific evidence and making appropriate public health product-based determinations. LD 1693 should be amended to include an exemption from the flavor ban for products for which FDA permits the marketing of. Thank you for the opportunity to comment.
Thank you for your testimony. Were you planning or did you already submit written testimony?
We will be submitting written testimony.
Thank you.
Thank you.
I'm not seeing any questions, so let's go to Anthony Scott. Welcome.
Thank you. Good afternoon, committee members. My name is Anthony Scott. I'm an owner of Portland Smoke and Vape and a member of the Maine Vapors Association and speak against LD 1693. I recall this committee wanted to see laws that mirrored alcohol and marijuana laws to regulate flavored vapes and curb youth vaping. That is exactly what has happened in the last couple of years. The legislature passed 21 age purchase limits, an excise tax on vaping products to help fund education programs and enforcement, as well as discourage initiation by youth because of the cost of the items. Restrictions on shipping of tobacco products to Maine residents have been strictly enforced by state officials. The federal government passed shipping restrictions, flavored pod bans, and continues to go through an extensive PMTA process with companies, which helps enforce better marketing practices and ensure that products being sold in stores are being regulated properly for the health and safety of the people. I understand how important it is to see youth use of vape products to be on a decline, and recent studies have shown that there has been a decline in youth vaping. This is exactly what this body set out to do, so it could allow for these products to be used as a harm reduction tool and not take away rights of the adults in the community in the process. I hope that this committee will look at the recent data that shows declines in vaping rates. If more needs to be done, I would propose moving flavored vape products to 21 plus only stores to further restrict visibility throughout the state, like marijuana stores. I would suggest stricter penalties for selling to minors, including possible revocation of license, special licensing for flavored vape stores to narrow enforcement, and age verification at point of sale. I understand menthol cigarettes could target vulnerable communities such as LGBTQ, minorities, and people of color, and I'm not here today to dispute that. However, vape shops are not big tobacco and are not fundamentally the same. Vape shops and vape companies set out on a goal to help all former smokers. I don't believe you could say that as a cigarette company. We have a culture in this country made up of millions of former smokers from all backgrounds. We have a culture that brings people together that are heading on a path that has proven to kill over 400,000 people a year. I ask that the committee consider vaping and smoking of menthol cigarettes to be two different discussions and not lump them in together because it is two entirely different arguments. The recently enacted ban in Portland was a devastating blow to our business. We worry about our ability to be competitive in the market, and this has put an incredible strain on the lives of our entire staff as everyone worries about the future of our business. We have 15 employees and growing. As an owner, I feel personally responsible for working as hard as I can to ensure my staff doesn't have to live with the uncertainty my brother and I live with daily, and will continue to have. Thank you. We'll continue to have a job no matter what happens, but still, we must consider whether we will have a viable business if the state enacts a flavor ban. Flavors make up roughly 65% of our sales, and we believe we will lose other sales if customers find other stores to frequent in New Hampshire or return to smoking cigarettes. Please consider the adult smokers that have chosen a safer alternative and what their options will be if this is enacted. I appreciate your time.
Thank you. Excuse me. Thank you for your testimony. Thank you for being here. Let's go, since I seem to have missed Alpesh Patel, let's go to you next. Trying to get back in alphabetical order. Alpesh Patel, are you available to unmute? Okay, let's go to Ben Brooks then, and we'll come back to Mr. Patel. Welcome.
Hey everyone, thank you all for your time today. My name is Ben Brooks. I'm a category manager for Noria Energy. I'm here today to voice our opposition to LD 1693. Noria operates 148 gas stations throughout New England. 29 of those are in the state of Maine, and we employ over 400 people in the state. I've worked in the convenience store industry for over 20 years, which has afforded me the opportunity to witness purchasing behavior shift as local and state tobacco restrictions take place. Simply put, in my experience, state prohibitions of the sale of products that are still legal in neighboring states and under federal law do not work, especially when these products remain legal to possess and consume in the state. Most recently, in 2020, Massachusetts passed a similar law to LD 1693, In the weeks and months that followed, we watched our cigarette volume in New Hampshire and Rhode Island and a little bit in Maine increase substantially. These increases were unheard of in a traditionally declining category. Based on this data, it was clear very early on that the stated intention of the Massachusetts flavor ban was not working. These products were still finding their way onto the streets and into the homes of Mass residents. The main reason for this is that consumers of any packaged good want what they want, and they'll find a way to get it if it's still legal to use and possess. They will get it by traveling to neighboring towns or states and often buy in bulk and resell to friends and family members. This increases the number of private sale tobacco transactions taking place in the community. Collectively, I think we can all agree that we don't want any tobacco sales happening outside of a licensed retailer's operation. These transactions cause lost tax revenue, and proper age verification practices are not happening. To that point, licensed tobacco retailers such as Nerea, we value our licenses to sell these products. At Nerea, we take great precaution to ensure that the tobacco products we sell are only sold to those age 21 and older. All of our frontline employees are trained extensively on age verification practices, and we utilize ID scanning in our point of sale registers. Lastly, I want to add that while I am here today representing a Massachusetts-based company, I am also here as a resident of Hollis, Maine, voicing my personal opposition to this bill. I am active in the substance recovery community in Maine and understand substance abuse, education, treatment, and recovery all too well. My story with nicotine use is an example of how this bill will hurt adults trying to stop using traditional cigarettes. I smoked regular non-menthol cigarettes for 16 years before switching to electronic cigarettes 7 years ago. I used mint, menthol, and flavored e-cigarettes to quit because I did not like the taste of tobacco in the flavored in the e-cigarettes. I have not touched a combustible cigarette for over 7 years.
30 seconds, Ben.
Thanks. And I continue to use e-cigarettes and other non-combustible products because I enjoy it. And I firmly believe that my health has improved since quitting combustible cigarettes. I'm a parent of 2 small children. I fully understand the risks these products pose to them, along with hundreds of other dangerous non-nicotine products that are legal in Maine. And I believe that education is the best solution for preventing kids from starting to use these products. In closing, I ask that you please do not pass LD 1693, as it will only hurt essential businesses and adults trying to switch from traditional cigarettes. Thank you all.
Thank you. Next, we'll go to Alpesh Patel. Welcome. You're still muted. Okay, we can see you
Hello?
now. There you go.
Okay. Hold on one, please. My name is Nancy Fuller, and I'm reading a letter from my boss who owns Friendly Discount in Westbrook, and on his behalf, because he had to go out of state. Let me bring the letter up. Due to the date change of the meeting, Alpesh will be out of state and unable to attend today's meeting. Alpesh wishes he could be here to deliver testimony himself. However, I will be speaking on his behalf this morning. I'm writing to you as a resident and small business operator across 3 communities in Maine. My business employs over 25 Maine residents, and I am disappointed to hear that Maine State Legislature is considering a tobacco tax increase in addition to a ban on menthol cigarettes, flavored dips, and flavored cigars across the state. I urge you to oppose this measure. The current state of convenience stores business is not a positive one. Between facing workers, shortages, increased wages, and declining economy, every day is a battle to stay open. My Westbrook location is the largest tobacco retailer in the state. The success of my Westbrook location has allowed me to invest in my 2 new businesses since purchasing these locations. I have invested not only in the property, but the employees. I was able to increase wages of loyal employees and have plans to upgrade both locations that will greatly impact these communities in a positive way. If LD 1693 passes, I would stand to lose over $1 million in revenue from just the flavor ban alone. An additional tax increase would only compound these losses. If you pass this bill, people like me will not be able to financially invest in our local communities. We will not be able to raise wages, and the only people who suffer are your constituents. I ask you please to vote against LD 1693 because I believe this state has much more important issues to address than a tax increase and flavored tobacco ban. Over the next 10 years, Maine stands to collect over $1.3 billion in tax revenue, of which a great portion comes from flavored tobacco products. LD 1693 is a terrible opportunity that will crush Maine small businesses and create a greater divide between us and a big outside chain. Please vote against LD 1693. Thank you for your consideration. Alpesh Patel, friendly discount.
Thank you for bringing that testimony forward. Next, we'll go to Brian Moran. Oh, a question from Representative Zager first.
Thank you, Mr. Chair. Just for the record, I think it needs to be understood if the an employee was testifying of her own free will on reading testimony of an employer. That wasn't clear from the testimony.
Oh, I feel the same way.
Okay, thank you very much. I appreciate it.
Thank you.
Thank you. All right, now we'll go to Brian Moran. Welcome.
Thank you. Chair Claxton, Chair Meyer, and members of the committee. My name is Brian Moran. I'm Director of Government Affairs for the New England Convenience Store and Energy Marketers Association. We represent more than 1,000 stores, which employ over 16,000 people throughout Maine. I did want to briefly touch on Part A. I know you're trying to consolidate, but I thought I could squeeze it in here and save a couple of minutes from this morning. Nexima supports Part A, which establishes the Trust for Healthy Maine. We agree it's important to properly fund tobacco use prevention, education, and control, which Part A does. We have one comment or suggestion is to have a retail tobacco licensee as one of the trustees. This would be a valuable voice, particularly as it relates to the board's role in establishing tobacco control policies. Nexima opposes Part D, which bans the sale of flavored tobacco. Supporters of flavored tobacco ban claim their motive is to protect youth. On this, we all can agree youth should not use tobacco. However, all flavored tobacco does not have the same youth appeal as mentioned by Representative Millette in her testimony on LD 1523. It's flavored vape products that demonstrate youth appeal. Other products like cigarettes, smokeless snus, pipe tobacco, cigars have very little youth appeal. Rather, they are statistically adult preferred products. The CDC's National Youth Tobacco Survey proves this. Yet LD 1693 treats all these products the same. Over the past 3 years, the federal government and FDA have taken sweeping action to reduce youth use and initiation. It raised the legal minimum age to 21, expanded the PACT Act, and banned flavored pod-style vapes. And as required, UPS, FedEx, and the Postal Service have done their part and prohibit shipping vape products. Most significantly, FDA's pre-market tobacco application process is nearing conclusion. This process makes illegal almost every vape product that exists today, with the exception of just a few it deems appropriate for the protection of public health. LD 1693 would ban these PMTA-approved products too. These are the same ones that FDA, with all their resources and technical and scientific expertise, believe is in the interest for public health. That
30
alone,
seconds, Brian.
thank you, Senator. That alone should highlight the failure of this policy approach. Finally, we've seen this policy implemented and failed in Massachusetts. In the 12 months following the inception of the state's ban, 87% of the cigarette tax stamp sales moved to New Hampshire and Rhode Island, and 8% transitioned to non-flavored tobacco, and still more migrated to non-flavored vape products. The state lost over $136 million, but just as important, it cannot demonstrate an iota of health benefits that were achieved. Nexima also opposes Part E, which would double the tax on cigarettes, and other tobacco products. Since 2019, the legislature passed a law requiring equalized taxes. So as one goes up, the other does too. In summary, Maine already collects over $136 million in tobacco excise taxes. We know tobacco tax is the most regressive tax out there. Furthermore, New Hampshire, your neighboring state, is the #1 tobacco export state in the country due to its already low tax rate relative to neighboring states. We urge you not to mimic Massachusetts' failed flavor ban policies. Thank you, and I'm available to answer any questions.
Thank you, Mr. Moran. Questions for Mr. Moran? Seeing none, we will move on to Ben Rajadurai. Welcome.
Thank you. Thank you so much for your time and holding this hearing today. Wanted to testify in opposition to Section D of LD 1693. The evidence clearly demonstrates that if enacted, this bill would have a disastrous impact on businesses as well as public health throughout the state. 72%, sorry about that. It would kill thousands of jobs and cost business owners their livelihoods, and I think have a truly devastating total economic cost. Studies have repeatedly shown that flavors, which Section D would prohibit, are critical to helping adult smokers make the switch to vaping. Adult smokers who've used flavored vapor products are 43% more likely to quit smoking than adults who use unflavored products, according to recent studies. Furthermore, bans on flavored vaping products are shown to increase youth cigarette smoking. A study from Dr. Abigail Friedman at the Yale School of Public Health found that when San Francisco imposed a similar ban in 2018, youth smoking actually doubled. And as a result, I think that this is just misguided legislation, and we urge you to oppose it. Thank you so much.
Thank you for your testimony. Questions? Seeing none, we'll move to Chris Bollier. Welcome.
Thank you. Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Chris Bollier, and I am the Director of Retail Operations for Cigarette Shopper. I'm here today to speak in opposition to LD 1693. We operate 21 tobacco-only stores in Maine and have some 100 hardworking employees. LD 1693 would double the state excise tax on almost every tobacco product in our stores and prohibit us from selling any flavored tobacco product. We train our employees in order to ensure that anyone under the age of 21 does not enter our stores or purchase tobacco products. In fact, over the past 10 years, our stores have been inspected by the FDA some 238 times, and our success record is over 99% compliance. That said, we do believe our adult customers who choose to use tobacco products should not be targeted for tax increases or a flavor ban. Tobacco products are used by less than 20% of the state's population, who are generally of lower economic status. These Maine residents need to be represented, as well as their minority voice may not be widely heard. Even so, they deserve to be free of overtaxation, which LD 1693 would cause. The fact is that these tax increases will have a large impact on tobacco smuggling into Maine. New Hampshire cigarette tax is $1.78 per pack, and New Hampshire does not have a sales tax, which means a carton of cigarettes in Maine would cost up to $28 more than across the border in New Hampshire. With that substantial difference, and when you understand that flavored tobacco products make up 25% of our total sales, you can be sure two things will happen. First, our customers will go to New Hampshire and stock up. And second, smuggling of cigarettes from New Hampshire and other lower tax states into Maine will increase. The effect of this bill is to take legal sales away from legitimate Maine businesses like ours and give it to New Hampshire retailers or to criminals. That does not sound like a policy that is in the best interest of Maine or of Maine youth, and it is certainly not in the interest of my business, my customers, or my employees whose jobs would be in danger if this bill passes. Please support Maine businesses, residents, and youth and oppose LD 1693. Thank you for your consideration of my concerns.
Thank you for being here today. Seeing no hands up, we'll move to Christine Peters.
Good afternoon. Thank you for allowing me the opportunity to speak. My name is Christine Peters. I am the COO of Maine Smoke Shop. We are an employee-owned company that has 18 locations throughout Maine. We employ 80 plus employees. We are also a 21 and over store. We have a strict IDing policy at the door. We ID anybody that looks under 30. If they can't provide ID, they're not welcome in our location. We have been responsible, compliant retailers. We have more than 20 years of being in business in the state of Maine. Our compliance rate is more than 99%. We train our employees yearly. We use the Healthy Maine No Butts program, a program that 20 years ago, you would go to Augusta and take the training. Now is an online program that has gone from 30 questions down to 6. The scope of banning all flavored tobacco products is crazy. There's very little youth appeal on all flavored tobacco products. I'm here today to testify for my customers, Jay that buys Grizzly Wintergreen that's 47 years old, John who buys Cherry Cavendish pipe tobacco that is 76 years old, Karen that smokes menthol cigarettes that's 45 years old, a Skowhegan police officer that doesn't want their name used that buys snus that's over 30 years old. All of these products I just mentioned have very little youth appeal. I think that we can safely say that it's not retailers that are providing this product to middle school kids and high school kids. I think we're all together that we don't want to see that happen. You know, I'm not here to represent Big Tobacco. I haven't been asked to testify because Big Tobacco asked me to. I'm just here as a business owner that's concerned about her employees. In 2009, the state of Maine tried to do a small flavor ban that took cigars off the market. Swisher Sweet Cherry was one of them, which had zero youth appeal. No high school student was looking for Swisher Sweet Cherry. However, we at the time had a store in New Hampshire, and I can assure you that sales of Swisher Sweet Cherry blew up in our New Hampshire store. We had people that would call 2 weeks in advance and place an order for the whole neighborhood that was looking for this product. There were many other things that were banned at this time as well. And I can say for sure, because we had a store in New Hampshire, people drove over the border to get their product.
30
So
seconds.
I'm asking you to please do your research. Please look at Massachusetts before you make any decisions. Thank you.
Thank you, Ms. Peters. Seeing no questions, we'll go to Christopher Hudgens. Welcome.
Thank you, Madam Chair, members of the committee. My name is Chris Hudgens. I am with a company named Alfacher. We are a producer of hookah tobacco, and I'm also on the board of the National Hookah Community Association, which I am representing here today. The NHCA serves as the voice of the hookah community. So we represent everybody from producers to distributors and retailers, as well as hookah lounges and users of the product. We're speaking in opposition to Part D of 1693, which is the flavor ban, because the flavor ban would be a full ban on hookah, and that's a little bit different than some of the other products. All hookah is flavored, as it has been for hundreds of years, and thus this would be a complete ban on hookah in Maine. Hookah originated in the Middle East and is widely used by Middle Eastern, Armenian, Turkish, East African, Indian, Persian, many other minority immigrant citizens in this country who have brought this tradition over with them when they immigrated to the United States. Hookah has served as a community and a sign of respect in these homes, and it is a cultural practice for many of these folks that would be completely taken away in Maine with the passage of this this bill. I want to be clear that hookah is different than many other flavored tobacco products. Hookah can only be smoked in a hookah pipe, which is about 2 or 3 feet tall. They can cost up to several $100s, but usually at least $75, $100 and up. As I mentioned, it's very tall. It takes about 20 or 30 minutes to light. So it is not something that a youth could easily conceal. It's not something they could smoke in their class or put in their backpack or smoke in the boys' room at the end of the day of school. It's just not something that is very affordable for them. It's not something for them that they can easily access, and certainly very difficult to use and use discreetly. So we do not have the same youth use issues as many of these other products. In fact, the CDC's most recent youth tobacco survey found that just 2%, roughly 2% of middle and high school students had used hookah in the past 30 days. This is 5 times less than vape or some of the other products. So there are important barriers already in place to prevent youth access to the product and to use it. It's not sold in convenience stores. It's sold in specialty tobacco shops and hookah lounges. We support making those shops 21 and up, and certainly anything else we can do to strengthen protections against youth using this product. But we don't believe the product should be abolished, and we don't believe that folks who immigrated to this country and want to bring some cultural practices with them should be banned from doing that. The other thing I'll add is that hookah is only roughly about 15% tobacco. As I mentioned, it's been made with flavored for many years. Honey or molasses was often used originally. So does not have the same tobacco content or nicotine content of really any of these other products. It's much smaller. And again, it's used in more controlled environments and is very difficult for a youth to access. So we ask that you exempt hookah from this bill. Again, hookah can only be used in a hookah pipe. It's not something you can roll up and smoke. It is a wet product. It's not something that can be used in any other form. So we believe that it's important that this product remain on the market. It does not have some of the challenges that maybe other products do. I will add that recently California, when they passed their flavor ban bill, it's now on a referendum ballot, also exempted hookah from their statewide ban. We ask you to do the same. Thank you, and I'm happy to answer any questions.
Thank you for being here today. Seeing no questions, we will move over to Christopher Jackson. Welcome.
Good afternoon, Senator Claxton, representatives of Health and Human Services. My name is Christopher Jackson. I'm a business owner here in the state of Maine. I think we can all find common ground and agree that tobacco is bad and needs to be regulated. But vaping is not tobacco, and it's the single most effective harm reduction tool a smoker has to quit. When you eliminate flavors, there will be an explosion of traditional tobacco use, as we've seen in other cities across this country. You heard it yourself, smoking kills nearly 500,000 people a year. And as cliche as it may sound, prohibition does not work, and it will create a black market and force over state line sales. Everyone has been correct to say that tobacco usage has been on the decline for decades. And the reason is strict policies have been put into place to reduce youth exposure, advertisements, online sales, education, and enforcement. The vaping industry has also put similar policies into place. As we've heard already, advertising on social media is prohibited, eliminating online sales, the PMTA process, which will eliminate the bulk of the products we sell today. This bill will destroy already struggling businesses in the state, such as mine. Evidence does show that youth vaping is on the decline, and there's no reason not to believe it will not continue to decline with strict policies such as these. I urge you to separate tobacco and vaping and treat it as we do marijuana, putting it into specialty stores, 21 and plus, keeping it out of sight, out of mind of minors, while allowing adults access to such a successful harm reduction tool such as vaping. This bill is a minor inconvenience to consumers as they can still obtain these products, and a death blow to businesses such as mine. It is a Band-Aid for a much bigger issue. And when I hear about a loss of funds when it comes to the MSA, you're probably correct about that. Mass settlement agreement, people are switching to vaping. It's having a profound health impact. People see it. It's not just to do something because it's cool. You talk to any former smoker that switched to vaping, and the health differences are incredible. Cigarettes have roughly 7,000 chemicals in them, with over 250 harmful chemicals that we know of, ranging from hydrogen cyanide, carbon monoxide, and ammonia. There's 4 main ingredients in vaping products, and the health benefits are astronomical for those who use them correctly. We certainly don't urge anyone to pick up vaping just to do it. It's been a very successful tool for smokers to get off cigarettes. I asked for you to explain why
30 seconds, Chris.
the products we sell, there's a 43% excise tax on these products. The loss in funds from the MSA, I'm not sure where the funds are going from our 43%. A store such as mine sends in tens of thousands a month to the state in excise tax alone. And you will more than likely see an increase with the MSA funds when you ban flavored products, because traditional tobacco use will increase. I urge you all to sit down with stakeholders such as myself and have an educated conversation about many different ways that we can mitigate the youth exposure in use while using current data. Using the current data is extremely important, not going off of past data, but going off of data that's been more current after certain policies and stricter regulations have been put in place. Thank you.
Thank you. Seeing no questions, Clifford Norton III, welcome.
Good afternoon, Senator Claxon, Representative Meyer, and other distinguished senators and representatives. My name is Clifford Norton. I'm the owner of Stewart's Grocery and Takeout in Jonesport, Maine. I'm speaking to you as a resident and a small business owner. The proposed legislation LD 1693 is going to cause great harm to my business, and I'm speaking to you today to explain why you should not move forward with this bill. My business generates approximately 1.8 million in revenue each year, of which approximately 33% is tobacco and tobacco-related products. The menthol tobacco portion represents about 186,000 annually. Please note that the annual profit from these menthol sales is approximately $27,000, which represents a full-time pay of an employee. Unfortunately, the loss of that income would result in my store, which I only employ 5 people, of losing 1 employee. There's no way for me to offset that loss of revenue and income. And I'm sure I'm not the only convenience store that will be in this situation. I fully understand you are trying to protect the public health, but this type of legislation is not the answer. It's going to create a black market in the state that's going to end up in unregulated and untaxed product. Currently, the state benefits from not only the tobacco tax, but the sales tax on those products. The state also benefits from retailers such as myself doing our due diligence to make sure these products don't get in the hands of the younger generation. I myself instituted an electronic carding process where tobacco-related products are not sold without proper identification of all customers. That's right, all customers, even my father, who is 72 years of age. My registers will not allow the product to be sold. Once it's scanned, it requires an ID. If that ID is not scanned, it will not even populate to the screen. Make it a requirement versus restricting your adult choices. Have you given any thought to the sale of menthol migrating to New Hampshire? I already have customers saying that they will go there to do that. Now you are not only cutting tobacco sales, but likely cutting into liquor sales as well. If my customers go to New Hampshire for their cigarettes, logically, they're going to pick up other things tax-free, and that could include liquor or many other products. Please note that there are plenty of evidence that shows that is exactly what happened in Massachusetts when they banned flavored products. Most of the sales went to New Hampshire and Rhode Island, 80% to New Hampshire and 40% to Rhode Island. This is based on excise stamp data that I was able to obtain. On top of everything else,
30 seconds, Clifford.
Yep, thank you. On top of everything else I mentioned, the timing of this bill is kind of a bad situation. The country, the state, the community is still dealing with the ravages of the pandemic, which has increased operational costs and some of us the ultimate price. My business, as well as other businesses like mine, need revenue sources available to come up with the ways out of this pandemic. Stop LD 1693 before the ramifications I've listed here and others do devastating damage to our already struggling economy. Thank you for your time.
Thank you for being here. Seeing no questions, we'll move to Dan Riley. Welcome.
Good afternoon, Chairs Claxton and Meyer and members of the committee. My name is Dan Riley. I'm an attorney with a firm in Norman, Hanson, in Detroit here in Maine. I'm here today on behalf of clients, the Northeast Wholesale Association and Reynolds American. I submitted written testimony last week, dated February 4th. So hopefully you have that in your possession, because I also provided with that testimony 2 exhibits. I'll make 4 quick points. The first is that, as you know, Part D of this bill was the subject of LD 1550, which this committee dealt with last year. It sits on the unfinished business calendar in the House right now. Part E of the bill was the subject of LD 1423, which the Taxation Committee dealt with last year, was reported out of committee, failed in the House, the majority report did, was carried over in the Taxation Committee, and was just amended by the Taxation Committee last week with an amendment from Representative McCrate, and it was unanimously supported by the Taxation Committee. That amendment will help you in your deliberations with respect to not only these 2 bills, but also LD 1868, which you heard last week, last Thursday. So I'd ask you to take that into consideration. Finally, I provided 2 exhibits to you for your consideration. The first is a letter submitted by the Department of Justice to the U.S. Federal District Court on behalf of the FDA, essentially demonstrating the FDA's compliance with the Federal Tobacco Control Act. And it's only a 3-page letter. It's very, very informative and will help you understand what the FDA has been up to. The second exhibit is a news release from the FDA, which demonstrates their enforcement efforts to go after those products that are coming into the United States from overseas, which really are the products that that all the people that have been testifying have been concerned about, and those are the puff bar type products. That FDA news release talks about how the FDA agents working with Customs and Border Protection seized products at the Dallas-Fort Worth Airport and confiscated them so that they couldn't be sold. So I'd ask you to take those 2 exhibits into consideration, because I think they show evidence of the fact that the Federal Tobacco Control Act is being enforced by the FDA. And I think that will take care of much of the problem. With that, I'd ask you to remember that one of the reports on LD 1550 did provide an exemption for PMTA authorized products, and I'd be happy to answer any questions you may have.
Thank you, Attorney Riley. Seeing no questions, we will move on to Gregory Conley. Welcome.
Good afternoon, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Gregory Conley. I run a nonprofit called the American Vaping Association, which was founded in 2014 with 3 principles in mind: harm reduction, drug reform, and respect for individual rights. And it's because of all 3 of those principles that I am here today to urge your opposition to LD 1693. As we know from decades of work in drug policy, that prohibition is failed public policy. And the only people that will benefit from this law and the sky-high excise taxes that come along with the bans will be informal dealers as well as New Hampshire shop owners. That's what we have seen from Massachusetts, is that usage has not really declined, especially compared to other states. Instead, what you have are more people crossing the border, buying in bulk, selling to their friends, family, even going beyond and selling online to people who just respond to a Facebook post. We don't want that to occur. Previous speakers have spoken at length about the problem of youth vaping, and it absolutely is a problem. That's why in 2020, we had the youth tobacco age raised nationally to 21. That's why we've seen various other measures taken into place at the federal level, including online sales limitations that have worked to get us to where we are today in 2021 with 7.6% overall usage among youth, middle schoolers and high schoolers. That brings us to a point where for high schoolers, 89% have not vaped in the last 30 days. 95% do not vape frequently. Obviously, just like with cannabis and alcohol, ideally we would come before you today and say usage among youth has dropped to zero. But just like with cannabis and alcohol, we can't say that because we know no generation, no teenage generation in modern American history has ever met that ideal of no youth experimentation. So I just want to encourage you to rethink this issue. It has started happening rapidly in the tobacco control and public health community. Just last year, the Chronicle of Philanthropy published a breaking expose revealing a great deal of concern in the traditional tobacco control community. The stalwarts, the people who fought for years to hold the cigarette companies accountable, they are saying that Mayor Michael Bloomberg's $150 million slush fund that he has set up to lobby for laws like these, flavor bans to prevent adults from accessing these products, they may actually be and likely are perpetuating cigarette smoking. And when you perpetuate cigarette smoking, you just perpetuate disease and death. And these bans are not going to solve much. So
30 seconds, Greg.
I will give you your 30 seconds and thank you very much. I'm glad to answer any questions.
Thank you for your testimony. Seeing no questions,
Thank
we
you.
will move to Kelly Williger. Welcome.
Good morning, Senator Claxton, members of the Health and Human Services Committee. Can you hear me okay?
We can.
Okay, thank you. So I'm going to echo some of what Greg said. He took some of the words right out of my mouth. But the simple fact is that adults enjoy flavored products. Vape manufacturers do use flavors to give incentives to smokers to entice them over to non-combustible options, okay? Cigarettes have been killing people for, as you know, many generations now. The flavors do help those adults make that switch over. Banning flavors and adding high sin taxes reduces the options that persuade those same people. Just because something is sweet or flavorful does not mean it is intended for children. Adult products such as alcohol and marijuana products line the shelves, and yet there is no pushback to any of those products. And why is that? Because they're all put in 21 and over shops. You have to show identification. Vaping has taken on those same restrictions. Nobody comes into my shop that is not 21 or over. If they do, they are immediately stopped at the door, asked for identification, and asked to leave. We've had people come to the door and say, well, I just want to come in and look. No, that's not the way it is. You cannot even enter the doors of my shop until you have shown proper identification. I'd like to move over quickly to talk to the kids themselves. So unfortunately, the 2001 youth risk survey data is not, 2021, sorry, youth data is not quite compiled yet. So the only data that I have is from the 2017 to 2019. I would say that that data probably reflects the worst on our products. That is probably where the height of the youth epidemic was. But I'm going to use those numbers anyway because I think they really show not only has there been extreme improvement because of the rules that we've put in place, but it shows the comparison that I'm trying to show you. So it's middle school and high school. I have only taken the grades 9 through 12 numbers, and I've compared them between vaping, alcohol, and marijuana. So the very first question that I wanted to let you guys know is, the question is, have you ever used a vapor product? This is even one time. So just one hit off of a product. These kids were asked. Also the same for alcohol and marijuana. So grades 9 through 12, it's 31 to 55% of kids who have tried one of these products, and that's the vaping. Alcohol is next, 32 to 62%, and then marijuana, 21 to 48%. I know I'm spewing out these numbers really fast, but as you can see, if you look at those three categories, they're all very similar. And yet we don't have these same conversations about, you know, Maui Wowie flavored marijuana. We don't have these conversations about Swedish fish on the bottles of vodka or cotton
30
candy.
seconds, Kelly.
Thank you. One quick thing, I'll skip some of my others that I wanted to make sure to point out, is kids were asked where they were getting their vaping products. And again, this was before the PACT Act. So this was before products were banned from being shipped to residential. Now they can only be shipped to verified stores. So kids were asked back then where they were getting their products. Store-based, convenience stores, supermarkets, gas stations, or vape stores. Grade 9, 2%. Grade 10, 3%. Grade 11, 5%. Grade 12, 7.8%. So even at its peak, less than 8% of young people were getting their vapes inside of a store. It was all being shipped online where age verification was impossible. We now have closed those doors for them. The youth is going to be in a much better place. Thank you so much for allowing me to testify today.
Thank you, Kelly. Seeing no questions, I thought maybe it might be time for a quick 5-minute stretch break for the committee. And so we will be back at 2:17 and we'll pick up with Kyle Feldman and then Michael Madden and Mark Hinckley. So 5 minutes, we'll see you then.
Mr. Hinckley, your mic is still on.
Thank you, Representative Connor. I've been busy turning off mics.
We'll give our committee members a couple of seconds to get back up on the screen. I want to take this opportunity to remind all those providing testimony that we are running a 3-minute clock. At 2 minutes and 30 seconds, you will hear either Senator Moore or Representative Griffin give you the signal, and we would ask that you kindly wrap up your testimony and meet that 3-minute clock. We will move next to Kyle Feldman. Welcome.
Good afternoon, everybody. Good afternoon, Health and Human Service Committee of the state of Maine. I'm writing you as a wholesale distributor, National Convenience Distributors, that supplies hundreds of retail locations in Maine with food, sun-dries, and tobacco products. I'm disappointed to hear that Maine is considering LD 1693, a bill that would increase the tax on cigarettes by $2 per pack and would implement a ban on menthol cigarettes, flavored dip, and flavored cigars. I urge you to oppose the bill. A large tax increase, like the one you have proposed, harms retailers and wholesalers alike and creates unintended consequences like illegal smuggling. The COVID-19 pandemic has put an enormous burden on our business, and frankly, many of our customers have closed their doors. Now is not the time to put an additional strain on an already ravaged business community. I come to you with a unique perspective, as my company, National Convenience Distributors, also services hundreds of locations in the state of Massachusetts. Banning flavored tobacco products did not work in Massachusetts, and it will not work in Maine. In the 18 months following the flavor ban in Massachusetts that went into effect on June 1st, 2020, we saw sales move from Massachusetts to New Hampshire, Rhode Island, Connecticut, and New York. New Hampshire residents aren't smoking twice as many menthol cigarettes. Instead, the flavor ban has created an illegal black market. I have seen pictures and video from my customers with individuals selling menthol cigarettes in their parking lots by the trunks loads and by the trailer loads. Lastly, the FDA is using a science-based approach to evaluate each product via the pre-market tobacco application, the PMTA, and modified risk tobacco product, MRTP application processes. The FDA has allocated millions of dollars of resources to properly evaluate each individual product. Please let the FDA do their regulatory job. I urge you to not move forward with such a massive tax increase and broad ban that will undoubtedly hurt small businesses. Thank you so much for your time today.
Thank you for being here. Seeing no questions, we will move to Mark Hinckley. Welcome.
Welcome. Thank you for giving me the opportunity to speak. Many of my associates in the convenience store and wholesale industry have already addressed most of my points against LD 1693. I would like to speak a little more about smokeless tobacco. Smokeless tobacco in Maine, 85% of smokeless tobacco sales are from flavored smokeless tobacco. As many of my associates have already mentioned, many residents in Maine live close to New Hampshire and will drive to New Hampshire to purchase the product, thus reducing the tax revenue in Maine. In addition, through many years of experience in Massachusetts, which has a high smokeless tobacco rate, there are people who will come up from Pennsylvania, which is a low tax rate. The Pennsylvania retail price on smokeless tobacco is less than the wholesale price in any of the states in New England, and these what we call trunk slammers will come and sell product illegally to many independent operators in Maine and individuals. And that is all I'd like to speak about. Thank you.
Thank you for being here. Seeing no questions, we'll move to Dr. Michael Madden. Unmute yourself and let us know where you're from. You're still on mute, Doctor.
There we go. Now I can.
There you go.
Great.
Okay, sorry about that. So I am actually a Pennsylvania resident. My name is Michael Madden. I'm a family doctor and the former chief medical officer of a multi-state managed care company that served the Medicare and Medicaid populations. I've been practicing medicine for more than 36 years and have worked extensively on issues like opioid addiction, HIV, and smoking. While Reynolds has compensated me for my time in preparing my testimony, let me be clear that the opinions expressed are my own. I speak today in opposition to the portions of LD 1693 that would ban the sale of flavored tobacco products in Maine. And I urge you to consider the public health need to balance limiting youth access to tobacco products with the enormous potential that non-combustible tobacco products present for tobacco harm reduction. Smokers die prematurely, not because they consume nicotine, which is not a carcinogen, but because of how they consume it in a combustible form. For example, moist snuff users, the majority of whom use flavored products, experience significantly lower risk of disease than smokers. And leading health authorities have agreed that vapor products may substantially reduce smoking's harm. Industry data show that 66% of adult moist snuff users and more than 53% of adults who make the switch from vapor products choose non-tobacco flavored products. This bill as written would deny Maine residents access to tobacco products authorized for marketing as modified risk tobacco products. Fully half of the products the FDA has authorized through this MRTP pathway and deemed appropriate for the protection of public health are flavored mint or menthol products. Be clear, youth should not use tobacco products of any kind. The state and federal laws banning the sales of all tobacco products to those under 21 are the proper tools to address youth access. Enforce them aggressively. Data collected in 2021 and not known apparently to many of those who speak in favor of this bill suggest that they are working. Youth experimentation with vapor products has dropped by more than 60% in the last 2 years. And now only 11% of high school seniors have experimented with vapor products in the last 30 days on federal data. And youth smoking rates are at the lowest levels ever recorded, with only 2% of high school seniors smoking daily.
30 seconds, Dr. Madden.
Thank you. Thank you. True tobacco harm reduction requires a broad array of non-combustible tobacco products be accessible and appealing to current adult smokers. I urge you to reject this proposal that would limit the choices available today to adult smokers in Maine. And I'm happy to answer your questions.
Questions from the committee? Seeing none. Thank you for your testimony.
Thank
Moving
you.
on to Nicholas Carton. Introduce yourself and let us know where you're from, please.
Thank you. Good afternoon, members of the Health and Human Services Committee. My name is Nick Carton. I'm the Senior Manager of State Government Affairs at Juul Labs. And on behalf of Juul Labs, I want to thank you for the opportunity to testify regarding LD 1693. In addition to the testimony I submitted last week to the committee, I thought it was necessary to testify today, as Juul's name often comes up in these hearings and has been used several times throughout today's hearings. LD 1693 would prohibit a retailer from selling, distributing, or offering to sell or distribute any flavored tobacco product, including menthol vapor products. Additionally, this bill would ultimately double taxes on non-combustible alternatives that could disincentivize adult smokers from switching to a potentially less harmful alternative. We're concerned that LD 1693 would lead to significant negative consequences in Maine, such as increased or sustained cigarette use, reduced switching to potentially less harmful products, increased cross-border sales, reduced tax revenue, and a proliferation in illicit trade. As you've heard several times today, the U.S. Food and Drug Administration provides extensive federal regulatory oversight of tobacco products, including vapor. FDA has exercised its authority by issuing guidance related to flavored vapor products that removed all non-tobacco, non-menthol flavored cartridge-based products until authorized through a pre-market tobacco product application, PMTA. FDA can also regulate nicotine content and delivery of such products through the PMTA process or by establishing a tobacco product standard. The PMTA process is a rigorous science-based process conducted by career scientists and technical experts, which we believe is the appropriate forum to determine the role vapor and other innovative products can play to transition and completely switch adult smokers from combustible cigarettes. Juul's mission is to transition the world's 1 billion smokers away from combustible cigarettes, eliminate their use, and combat the underage use of our products. To succeed in that mission and to preserve the harm reduction potential of vapor products, we're focused on listening and building constructive relationships with regulators, policymakers, and other stakeholders. One of the key tenets to these efforts is our commitment to combat underage use through evidence-based interventions. Juul also supports risk proportionate regulation for vapor and other reduced risk non-combustible products. Within this framework, Juul believes that the regulatory balance should be weighted in favor of harm reduction, moving adult smokers away from the most harmful tobacco and nicotine products towards potentially less harmful non-combustible alternatives. Robust, informed regulation of tobacco and nicotine products and our category will always be appropriate. We're concerned that LD 1693 would lead to adverse consequences in Maine while being an ineffective way
30
to
seconds, Nicholas.
attempt to address underage use of vapor products, and the additional tax increase would be particularly ill-timed as adult consumers deal with broader inflation pressures across the country. We respectfully request that the committee put aside the proposed legislation and engage with stakeholders to develop a thoughtful, evidence-based regulatory approach. Thank you.
Thank you for being here today. Seeing no questions, we will move on to Nick Murray. Please introduce yourself and let us know where you're from.
Thank you. Good afternoon. My name is Nick Murray, Senator Claxton, Representative Meyer, distinguished members of the Health and Human Services Committee. My name is Nick Murray. I serve as a policy analyst with Maine Policy Institute. We're a nonpartisan nonprofit that works to promote policy solutions to increase economic freedom and individual liberty in Maine. I personally am a resident of Cornish. I appreciate the time to address this committee on this bill. As ardent opponents of prohibition here at Maine Policy Institute, we are in fierce opposition to LD 1693, especially the provisions that ban products for consumers who are adults, and also to raise taxes on those consumers. You'll have my testimony. I previously submitted written testimony last week, as well as a follow-up with a tax foundation analysis that looks at the recent study from about a month or two ago, from the Journal of the American Medical Association on the Massachusetts flavor ban. It's a really important lesson to look at that, but I think one thing that Journal of the American Medical Association paper did not address was the cross-border trade. It references this as one of the limitations. So it's really important to understand what the effects of the cross-border trade were in Massachusetts, and that tax foundation analysis that I included in my follow-up email addresses that. You'll note in that it compares the 12 months between June 2019 to May 2020, those 12 months versus the following 12 months, June 2020 to May 2021. Tobacco stamps sold in Massachusetts dropped 24% year over year, but they rose 22% in New Hampshire and they rose 18% in Rhode Island. So you look at that JAMA paper and it says, yes, sales of cigarettes decreased and tobacco decreased in Massachusetts, but the regional sales of tobacco and cigarettes remain unchanged. So by doing this, are we affecting the overall rates of smoking? I think it definitely we need more evidence to show that, because otherwise all these other studies we're showing is that we're squeezing the balloon and the air is going out the other way. So what happened when Massachusetts did this? They lost about 20% of their yearly revenue, and nobody in the region stopped smoking, it seems, because we're selling just as many cigarettes as we did before. So after all that, there's one thing that I want this committee to understand about this campaign, this group, Flavors Hook Kids, that's been putting paid advertisements online and in print, YouTube, banner ads, all of this. It's important to understand that this is funded by California smokers. So in 1988,
30 seconds, Nick.
Thank you. California voters in 1988 passed Proposition 99, which added a 25-cent tax to every pack of cigarettes sold in California. A portion of that funds the California Tobacco Control Program within the California Department of Health. One of the projects within this program is Flavors Hook Kids, this campaign that's lobbying around the country, including in Maine, with millions of dollars to enact these regressive policies. So I think it's important for the committee to understand that this is not a Maine-grown effort. This is funded by California taxpayers, and it's promoted by the California Department of Health. So if we want to allow these sort of ideas to be exported to Maine, I think we need to provide a higher level of scrutiny, and especially if we're talking about some money that's coming from out of state to do this. So please vote in opposition to LD 1693 because it is regressive, because it will hurt the choices of consenting adults. Thank you.
Thank you. Seeing no hands up, we'll move to Owen Casas. Welcome, sir.
Thank you very much, Senator Claxton, Representative Meyer, and members of the Health and Human Services Committee. My name is Owen Casas, and I'm submitting this testimony on behalf of the Maine Vapors Association. We very much appreciate the general intent of LD 1693, and we thank Representative Talbot Ross for bringing it forward. And I personally thank her for spending some time with me talking it over. On parts A, B, and C of the bill, we're neither for nor against. We'll simply encourage the committee to ask good questions of your staff and others while considering them. And we do oppose Part D as written, primarily because there are so many aspects I've used, as you've heard, of smoking and vaping and tobacco consumption associated with this consideration of a full flavored tobacco ban. And as I've looked at it, it's difficult to determine if this bill, 1693, is the most appropriate place or vehicle for a flavored tobacco ban discussion, as relevant as it might seem to the creation of the proposed trust in the Health Equity Office. Between the overlap of LD 1550 and Part D here of 1693, as well as what you heard before in 1523, and its proposed creation of the trust, our concern is that those very important conversations might crowd out this equally as important conversation, specifically vaping, how these products are evaluated, which you've heard on, how they're offered, rates of consumption, recent relevant data, and the impacts these products are having through scientific evaluation. And however this committee wishes to manage these issues, that's within your purview. But we would strongly encourage you to set the conversation of vaping aside to be discussed more in depth at a later time and date. And at that time, or at any time, we are happy to work with you in the legislature on vaping related concerns and separating them out from smoking and other forms of tobacco consumption. We have been following the CDC, the NIH, the FDA, and other federal professionals' developments around vaping, and feel that review and recent scientific studies and surveys and other relevant data is very much needed before finalizing any bans related specifically to vapor products. I thank you all very much for your time and consideration of this testimony. And as I'm going to use this last little bit, some handwritten notes that I have from listening to a lot of these conversations. And I was in the state legislature briefly as an independent, and many folks
30 seconds
are stating, thank you, that smoking is bad, and we couldn't agree more. And a full ban, it seems easy. It's a fix to your problem, and it's an easy fix. And what we are asking you to do is to work with us more in depth to understand the nuances and see if this could be right-sized to still achieve the positive outcomes that we want for our community and for our youth, while making sure that it's a body of language that addresses the problems that we have and doesn't necessarily overreach, but that's more of my opinion. So thank you all very much for your time, and I'm happy to answer any questions if you have any.
Thank you for being here today. Seeing no questions, we'll move on to Sarah Wall.
Good afternoon. Thank you very much, Representative Meyer and Senator Claxton, and distinguished members of the Joint Standing Committee on Health and Human Services. My name is Sarah Wall, and I am the Government Affairs Manager for the Northeast region at R Street Institute, which is a nonpartisan public policy research organization focused on promoting limited, effective government across many issue areas, including tobacco harm reduction. We are concerned about the provisions in LD 1693 that would ban flavored electronic nicotine delivery systems, commonly known as vapes or e-cigarettes, and that disregard the benefits of these reduced risk tobacco products in improving health. The R Street approach to harm reduction recognizes abstinence-only approaches to risky behaviors do not work at the population level. It's an approach the Maine legislature is familiar with, including in sex education and syringe replacement for substance users. We would ask this committee to apply this approach to nicotine use as well, because not every nicotine delivery product should be treated the same. Multiple health research organizations, including the FDA, have recognized that nicotine products exist on a continuum of risk, with e-cigarettes at the lower end, near traditional nicotine replacement therapies, and combustible cigarettes at the highest end. The Royal College of Physicians, too, estimate e-cigarettes are 95% less harmful than combustibles. These substantially reduced harms make e-cigarettes an important tool in the arsenal of tobacco cessation. In a randomized trial, smokers who used e-cigarettes as a cessation device quit using combustibles at roughly twice the rate of those who use nicotine replacement therapy. Flavored products are an important part of incentivizing this switch. In one study of over 4,500 former smokers who now use e-cigarettes, all participants called the variety of flavors, quote, very important in their decision to switch from combustibles. And 40% reported flavor invariability would have made it less likely for them to switch. R Street shares the concerns of this committee over youth uptake of e-cigarettes. In fact, we were one of the first national think tanks to advocate for raising the age of purchase to 21 so that they were less likely to fall into minors' hands. We continue to urge this legislature to take action to effectively prevent youth uptake of these products. However, flavors are not the primary reason youth begin using e-cigarettes. In fact, only 22% of minors cite flavors as the primary factor they began using them, while over 55% cited, quote, curiosity. Efforts to curb youth uptake should not come at the expense of the health of more than 220,000 Mainers who smoke
30
combustible
seconds,
cigarettes.
Sarah.
Thank you, Senator. Maine benefits when there are a range of accessible products that encourage less harmful alternatives to combustible cigarettes, while simultaneously prohibiting access and continuing to prohibit access to these products for youth. Accordingly, we respectfully urge this committee not to pass LD 1693. Thank you for your time and consideration.
And thank you for your testimony. Seeing no hands raised, welcome Thomas Bryant.
Representative Meyer, Senator Claxton, and members of the Health and Human Services Committee, my name is Thomas Bryant, and I am the Executive Director of the National Association of Tobacco Outlets, or NATO, and we have retail member stores across Maine. LD 1693 is not necessary due to numerous actions being taken by the U.S. Food and Drug Administration. Regarding these FDA actions, please consider the following. In February of 2020, the FDA banned flavored pod and cartridge-style electronic cigarettes that appealed to youth. Then, since September of 2021, the FDA has denied the marketing applications of almost 7 million flavored electronic cigarette and nicotine vapor products, and only approved 3 such products, just 3. That means these almost 7 million products need to come off the market, either have been taken off or will be coming off the market. Just last week, the FDA published an announcement on the agency's website that new federal regulations banning the sale of menthol cigarettes and all flavored cigars nationwide will be issued this spring by April, just a couple of months from now. With the federal government already removing millions of flavored electronic nicotine products from the market and now moving forward with new regulations to take menthol cigarettes and flavored cigars off store shelves, the need for a statewide flavor ban is significantly diminished, and we ask the committee to not proceed with this legislation. Also, the impact of pairing a flavor ban with a 100% tax increase on cigarettes and tobacco products will lead to significant cross-border and illicit tobacco sales. The empirical example of Massachusetts' statewide flavor ban should be considered by the committee. When Massachusetts banned all flavored tobacco products several years ago, 3 adjacent states, including Vermont, New Hampshire, and Rhode Island, experienced a collective increase in menthol cigarette sales that equated to 90% of the lost menthol cigarette sales in Massachusetts. In other words, the sales just went to neighboring states. This means that Maine adult consumers will simply go elsewhere for their menthol cigarettes and flavored tobacco products. And the state of Maine will also experience a dramatic reduction in cigarette and tobacco excise tax collections. In addition, the negative economic consequences to Maine's retailers will be severe, leading to employee layoffs and possible store closures, because tobacco stores rely on almost 100% for tobacco sales and tobacco-related products, and convenience stores rely for up to 36% of in-store sales of tobacco products. Take
30
tobacco
seconds,
out of the
Tom.
equation, and those stores may not be able to survive. For all of these reasons, we urge you not to support LD 1693. Thank you for your consideration.
Thank you for your testimony. Seeing no questions, we will go to Yael Asowski.
Thank you. I thought why would take a long time. Dear chairs and members of the Joint Standing Committee, my name is Yael Osowski. I'm the Deputy Director of the Consumer Advocacy Group known as Consumer Choice Center. I was actually born not more than 200 miles from Augusta in the Canadian province of Quebec, so very happy to represent the views of my organization and myself here today. While we believe that health equity is in itself a very noble goal, and there are many virtuous aspects of a Fund for a Healthy Maine, Part D of LD 1693, as many others have already spoken to, pertaining to the ban on flavored vaping products, we believe just goes way too far and would actually end up harming rather than helping many Maine residents. We're opposed to the bill for this very reason. I think first, though, we should acknowledge that the so-called structural deficit that took part and that was discussed in the first part of this really comes down to the fact that there are declining settlement dollars. Fewer people are smoking than they used to. They've either stopped or they're using alternative products that are less harmful. I think that's a success that pretty much no one has acknowledged. And there's still a lot of work to do, but that's at least one win. In 2020, I believe it was 16.5% of Maine residents were found to be smokers. That's higher than the national average, and that's about 181,000 family members, friends, community members. Around 30% of all cancer deaths in Maine have been attributed to smoking. That's 2,400 Mainers a year, many of your constituents and family members as well. But there's a growing proportion of Mainers that are starting to use new nicotine vaping devices. These do not contain tobacco, nor do they produce any of the negative effects of the traditional cigarettes. Yet too many, including many who've testified here today, have conflated them with cigarettes. I think that nuance is very important to reiterate before any law is passed before this committee. Vaping products and devices have been created and they've been sold by entrepreneurs to solve a problem, that of combustible cigarettes and their byproducts. And our smoking rates have declined in line with that innovation. According to all of the latest science and research that we have from health bodies in the United Kingdom, in New Zealand, and in Canada, health bodies that actively promote vaping devices, we know that flavored nicotine devices represent not more than 5% of the harms of smoking. Adults who are former smokers, they have been switching en masse to all of these products. It's a new innovative technology that can deliver the same effects of nicotine without the harms of tobacco smoke. And the flavors are integral to that switch. There are plenty of vapor stores across the state of Maine, whether in Augusta, Waterville, or Bangor, that have been providing all of these products to adult consumers. And we believe the option of providing that and not relegate it to the black market, where there will be no checks for ID, where there will be no regulation. We know what the impact of that has been from cannabis prohibition. We hope it would not be the same for these flavored vaping devices. They're important for adults. They're important for former smokers who are looking to switch and improve their lives. I think we should acknowledge that, allow them the choice, and make sure that our policies are fair, just, and based on scientific evidence. Thank you very much.
Thank you. Yes, Representative Perry has a question.
First of all, thank you for your testimony. And I am somewhat curious. Do we know what chemicals are being inhaled with the vape products?
So specifically, if you were to go to any vape store, normally they're going to have the propylene glycol, they're going to have their VG mix, and they'll mix it with nicotine. So these are the two sort of main ingredients. And some of the vape store owners have already discussed that a bit earlier in the testimony. So for any of the open systems that are sold in most of these vapor shops, it's pretty clear what's in there. We already have a good number of ingredients that are offered by many of these vape stores. When it comes to the cartridges and pods, Again, they've been severely limited in recent years, but all of that we do have on the record. I know that there's a lot of question about what's in them. I think that specifically you might be referring to the EVALI scare 2019. That was actually related to the illicit cannabis cartridges that actually injured, I think, around 2,000 people. But that was found to have been cannabis cartridges that were laced with vitamin E acetate. And the CDC did come out with a study on that. Unfortunately, it was too late, but just I think another outgrowth of what happens when things are relegated to the black market.
Do we have any information on the long-term effects of the chemicals that are in the nicotine products that are in vape?
Sure. We don't have any long-term studies on that. There have been a good number of pulmonary studies that are being conducted. There's a lot of universities in Israel that are very good with that. And also the United Kingdom. I think United Kingdom has been sort of a leader. They've been doing a lot more research on this. Again, we don't have any of the long-term studies since this market has really only been around about a decade or a decade and a half. But I know there are many researchers with grants that are conducting these studies each and every day. But also, I think you have thousands of vape store customers throughout Maine who've at least been able to improve their lives by switching away from smoking that could testify to their benefits.
Thank you.
I see that we've come to the end of our list, but there is a hand up. Brett Scott's hand up is in the attendee, and also Guy Bentley. So if you are intending to provide testimony, we'd be happy to hear it, and you will be brought over. Brett Scott, welcome.
Thank you. Yes, my name is Brett Scott. I'm the president of Smokers Haven. I have 12 smoke and vape shops throughout New Hampshire and Maine. And just would like to reiterate a lot of what has already been said, that I believe that vaping should be handled separately from traditional tobacco in regards to this ban. And being on the floor at our stores and interacting with customers, we've seen the impact that vaping has had for many individuals and getting rid of habits that they've had for 10, 20, 30 years in many cases. And the flavors are absolutely something they get adults to switch to vaping. As you've heard from many, it's an effective tool. And I really hope that it's something that you all take into consideration. It's a big decision that's being made here. And I think that we should consider the impact that it has on people that have these addictions to nicotine. And I personally welcome you to any of our locations to speak with the customers and be able to really see the side of it. There's a lot of changes that have happened in the market, such as the PMTA scientific review by the FDA, raising the age to 21. There's a lot of things that have happened already to help reduce youth access. And it often takes time for the public perception to change to reflect the changes that have happened. And I'm hopeful that you'll all be considerate of that and really look at this more before you just put vaping into the same equation as traditional tobacco, as it really is a tool that's effective, it works, and the market has shown that. There's a demand for the products. It's 21+ people that are coming in buying these products, and I guess that's all. Thank you.
Thank you. Seeing no questions, welcome Guy Bentley.
Thank you so much, Chair Claxton, members of the committee. Thank you for allowing me to submit testimony today. I'll try not to go over too much ground that's already been mentioned, both by the pro and con sides here, but just to put some numbers on what you've heard for the Massachusetts experience at the Reason Foundation, we've conducted an analysis of what happened the year prior to the implementation of the flavor ban and a year post the implementation of the flavor ban. And what we find is that there were 27 million extra packs of menthol cigarettes sold in the surrounding counties and 30.6 million extra packs of menthol in the surrounding states, meaning that there was a net increase in cigarette sales for Massachusetts and its bordering state of around 7.2 million packs. I would also like to reiterate what was mentioned earlier about when San Francisco implemented a tobacco flavor ban, with a study conducted by Yale University's Abigail Friedman, which unfortunately found that youth in the San Francisco area, after the ban was implemented, had double the odds of smoking compared to those in jurisdictions without the flavor ban. So unfortunately, the exact opposite of what was intended. Now, while prohibiting flavors, particularly in electronic cigarettes, may seem a solution to the problem of youth vaping, it should indeed be noted that youth vaping has fallen dramatically in recent years to the lowest point it's been in 7 years, with 89% of high schoolers not using e-cigarettes at all and 95% not using them frequently. I'll also add that the prestigious Cochrane Review, which is a body that looks at evidence-based medicine, has concluded that e-cigarettes are an even more effective smoking cessation replacement than traditional nicotine replacement therapies, and that prohibition of these sorts of products would limit access to smokers trying to quit traditional cigarettes. I will also add that the UK was mentioned earlier, and of course, I'm actually originally from the UK. And in the United Kingdom, we have had a significant public health success encouraging e-cigarettes as to draw people away from combustible cigarettes, with even vape shops in some of our leading hospitals. And we do not limit the availability of flavors in the United Kingdom. And youth vaping rates remain incredibly low. But with that, you have my written testimony, and I don't want to go over too much of what you've already heard, but happy to answer any questions in more detail. Thank you so much.
Thank you for being here today. Seeing no hands raised. Leo Delicata and Representative Perry appears to have his hand raised in the attendee list. So and Leo is here as well. So if Representative Perry would like to provide testimony, please bring him in, and we welcome Leo Delicata. Nice to see you again.
Thank you very much. Representative Myers and let's see, is he here? Yes, Senator Claxton. I apologize, had to be in two places at once, and I just rejoined. But I wanted to go on the record to indicate that just as we were against the LD 1523 this morning, we're against 1693, except, and this is what happens when you load a bill this way. Part B, we are in favor of. We believe that creation of the Office of Health Equity within the Department of Health and Human Services is a good idea. It gives a voice to that policy and a person to carry it out. As far as the other parts, C, D, or E, we're not against those as we are with the bill in chief, and just wanted to indicate that. You have my written testimony on this. Thank you.
Thank you. Seeing no questions, Representative Perry, welcome.
Thank you, Madam Chair. Representative Meyer, Senator Claxton, thanks for having me today. I apologize. I've been with you all day long. I gave up a whole day of work to be here, but had to run out and take a deal with an emergency. And I intended to testify neither for nor against, and I'm not sure if that's where we are or not, but I didn't want to lose my opportunity. Okay.
You have not lost your opportunity. Okay. Go right ahead, Representative.
Thank you. I honestly feel like I'm possibly more uniquely qualified to testify on this than anyone else, that you'll hear from. I've been in the industry for 40 years. My first job at 15 was in a convenience store. I spent 6 years for a grocery wholesaler. I filled in for salesmen when they're on vacation. So I think I was in 75% of the businesses from the Canadian border to the New Hampshire border. And I saw back in the 80s when there was a big price differential between Maine and Canada, little hole-in-the-wall stores along the border that were taking $20,000 or $30,000 a week of tobacco products to sell to the Canadians crossing the border. And I've seen over the years how the infrastructure of stores and such is largely just shown up on the New Hampshire side of the border because it's too hard to compete there. I have been opposed to the menthol portion of the ban statewide because I didn't think it was worth the price tag for what we were getting in return when you weigh it against other priorities such as drug addiction and homelessness and some of the things we see serious problems with here in Bangor. Bangor has gone ahead and passed a local ban on flavors, and I can tell you almost unequivocally that will put my business out of business, I'm confident of. And part of this bill, I support all the efforts in this bill to help people quit smoking, to keep people healthy, the healthy foods. That's why I'm neither for nor against. It's two of the vehicles that you get there with that I think are kind of problematic. So I can assure you, there are hundreds of families in a very low income neighborhood of Bangor that's had a store there for over 100 years, where I carry a large supply of food, fresh vegetables, meats, produce, things people need that will not be there anymore. It just won't. These local ordinances will not prevent anyone. I've got 30 years of experience of selling to people. I see what they buy and I see who quits with these changes. Statewide, it probably won't affect me. It'll be more problematic for others. I think you probably ought to get rid of all the exotic flavors of vapes. The exotic flavors, the tobacco, we don't sell a lot of it. It's mostly cigar products that people buy for smoking marijuana. That wouldn't hurt my business too much, but it's adults who, I was at a hearing this morning, we're trying to help the marijuana industry grow and mature in a way. And, so that's just one of the things that's used there. I want to talk about the tax. I've got 12 years experience on the tax committee, from when cigarettes were 37 cents a pack, went to 74, went to $1, then went to $2. And there's been dozens of efforts to double it, to go to 3 or 4. And I want to tell you what happened. When I went from 37 to 74, it was just one of those things. From 74 to $1 is kind of one of those things. When it went to $2, I think we didn't listen to or take seriously the testimony of the wholesalers, because of course they're the ones profiting, right? So they have a vested interest in trying to prevent it. But what they said largely came true. There's no longer, when I started 30 years ago, I had at least half a dozen wholesalers I could have chosen from: Christopher's in Madison, AG of Maine and Gardner, Pine State and Augusta, Warren Candy Bangor, Reed's Confectionery Holton, Condon Candy Presque Isle, Huntley from Washington County, Bugby Brown from Southern Maine, Pulsifer from Auburn. Those were all local wholesalers. There's not a single Maine wholesaler left. And it's the cost of these excise taxes on cigarettes is largely forced that consolidation. I'm sure there would have been plenty of it, but this really set that in motion. So I really think the tax portion, I think the local ban in Bangor could put me out of business. I think the tax portion could put me and many other people like me out of business, because the part you're missing is our prices, our retail is dictated by the manufacturers, the cigarette manufacturers. So I will put up front, I have not a lot of love for the cigarette manufacturers. We have to work together. The wholesalers, so if we go up $2 on an excise tax, the wholesalers will not go up $2 because they need to preserve their margin. If they're working on 10%, they're going to go up $2.20. And anytime there's a price increase, they actually try to grab a little more margin. So they'll probably go up $2.25. The manufacturers, however, will mandate to me that I only go up to 20 cents. So I am going to lose margin. And what we're not taking into account is 3/4 of our sales are on credit cards. Credit cards average 2.5% to 3%. So I'm going to lose another 7 or 8 cents per pack of cigarettes sold to credit card fees. Okay, so I'm going to lose margin because manufacturer won't let me go up as much as my wholesale. I'm going to lose margin because of the credit card fees. My inventory costs are going to go up $6,000 to $8,000, and it's just these little stores don't have that. So I support everything you're trying to do. I would like to be a resource. I don't want to drag this out any longer for you. I want to be a resource at your work session. We killed the $2 tax bill in tax, but we recommended moving forward with full funding of the federal guidelines, what we should be spending on tobacco cessation. I applaud every one of my customers who quits. I celebrate it. I apologize. I've gone over 3 minutes. I know I could go on for another hour, but I would really like to be a resource of someone who can tell you the practical hands-on implications of the two main parts of the ban on menthol. It's the menthol that I'm most concerned with, and the tax. And I'd answer all your questions if you have any.
Thank you, Representative Perry. Questions from the committee? Seeing none, I'm glad you were able to make it here today.
Thank you.
Yes, actually, our committee representative Perry has a question for you.
I just wanted to welcome Representative Perry to the Health and Human Services Committee.
Thank you.
moving on to what appears to be our final testimony for the day, Martin Cullip. Welcome.
Hello, thank you for pronouncing my surname right. Many don't. Senator Claxton, Representative Mayor, members of the committee, thanks for allowing me the opportunity to provide comments on Bill LD 1693. I'm Martin Cullip, an international fellow at the Taxpayers Protection Alliance in Washington, DC. Rather than improving health, we feel this bill will fail to reduce future tobacco-related death and disease by making it harder for adults to stop smoking cigarettes. We've submitted extensive written testimony, so I'll try and keep this brief. Electronic cigarettes have helped thousands of Maine adults quit combustible cigarettes, yet this bill doubles the taxes on cigarettes while simultaneously closing the route to far safer alternatives and making it more difficult and less appealing. In 2019, Maine implemented a vape tax, which led to an increase in cigarette tax collections, and a ban on flavours would be another obstacle to deter smokers switching to safer alternatives. And will lead many vapers to relapse into smoking, as has happened elsewhere. Many people have mentioned that. A variety of flavours in e-cigarettes is essential as it helps adult vapers distance themselves from their previous smoking habit. Just to expand on that, bubblegum flavour was mentioned earlier. I've smoked for 35 years. I'm 54 now, and bubblegum flavour is one of the flavours that I regularly use. So they're not exclusively aimed at children. It's something that we use to. Excuse me. I know you've had dog problems. I've got cat problems. I'm afraid today. Rather than impose draconian taxation and ban the sale of flavoured tobacco and vapes, Maine should encourage adult smokers to switch and properly fund robust tobacco control programs using existing monies. When framing policy, it's worth looking at what has worked elsewhere. Recent research found that countries with light touch regulations on vaping products saw smoking rates decline more than twice as fast as the global average. So promoting vaping as an alternative to combustible tobacco should be embraced and not feared. I'm happy to answer any questions, and thank you for your time.
Thank you for being here. Seeing no questions, that would appear to conclude testimony on LD 1693. Yes, Senator Claxton.
Thank you, Madam Chair. I just wanted to remind anybody who's been listening and has submitted testimony or is planning to go ahead and do that. Some of it is coming through, some of it's not, but we're investigating why. We do want written testimony as much as possible for us to spend time with between now and the work session. So thank you for that.
Thank you, Senator Claxton. And I'll add to that we accept testimony right up until the work session. Questions from the committee for our analyst, Sam Seneft. I am seeing none. Actually, Representative Perry has her hand up. Yes.
I don't know how to raise my hand. I do question, we did at one point have a Department of Minority Health, and I thought that was reinstituted. And so I'd like to know that. And then there's a couple of other things I'd like to know in terms of the CDC, because I know that there are programs for obesity that we've passed bills for, and other programs that are listed in this bill. I would like to know where the CDC is in terms of those programs that they have and what they're doing.
Thank you. Representative Connor.
Thank you, Madam Chair. Yes, I would like to know a little bit of information. I've been searching the internet the entire time, trying to find the answer to this. How much exact dollar amounts from the MSA that we get annually goes to actual education for tobacco? I've looked through the budget. I just couldn't find it. I'm sure Sam can probably pull it up in no time flat, but I'd just like to know what that dollar amount is and what the percentage is in relation to the total amount that we get. So that's one thing that I'd really like to see. Thank you.
Representative Craven.
Thank you, Madam Chair. I think I heard a lot of contradicting numbers today about how many youngsters, teenagers are actually vaping, and I was wondering if we could get the numbers, accurate numbers from the CDC. Thank you.
Seeing no additional hands up, I would ask Sam if there's anything else on our afternoon agenda.
There is not.
Then I would entertain a motion to adjourn.
So moved.
And
Second.
a show of hands, and we will see each other tomorrow in Augusta. Have a nice night. Thank you for your work today.